Okay.
Mr. Omoyo was with us. I don't know what. Let me.
Yeah, please ask
You're
him to
being called
unmute.
to speak.
Yes,
Oh,
please
he's
ask.
trying to unmute himself.
Yes.
Which name is he using, Ekra?
The host is not allowing him to unmute himself. The name is KENAPCO XCOM member.
Okay.
Maybe the host can unmute him.
Okay, okay. Kindly tell him to unmute himself. He can now unmute himself.
You can now unmute.
Good morning, members.
Good morning to you, sir.
Thank you, Anita. Let me start by recognizing the principal, Dr. Tana of RFTTI, as represented by Mr. James. I also want to recognize the Director, DTE, and also I want to recognize TVET for allowing us have this session. I want to thank especially RVTTI team fully for allowing us to use them as a case study in this subject. And therefore, I want to proceed now to make very few remarks. I want to talk to specifically our trainers and inform them and encourage them that indeed we are in uncertain times, unprecedented times.
Did we lose Mr. Evans? Mr. To, can you hear me?
Yes, I can hear you.
I think we lost him, huh? He could be experiencing challenges.
It could be. It's like he's experiencing some network challenges, but I can still see him.
Mm-hmm. Okay.
Mr. Omoyo, can you hear us? Mr.
Okay.
Omoyo, unmute again.
Sorry about that. I seem to be losing some connection, but
yes, please.
I can quickly proceed and wind up.
Yes,
so
yes.
I want to encourage our trainers and inform them that as KENAPCO, we are working tirelessly, and we know and we recognize the challenges that we are facing as a sector. And we hope that as we move along with partnerships, with collaboration with our partners of goodwill, as the ones we have today, we are going to overcome these challenges. I want to also encourage our trainers to be flexible and to be quick to adopt to change, such change that will be among them shifting to the digital world as a whole. Definitely, you might be aware about the online training program that is being worked on, and some of us, maybe some institutions have also implemented. Therefore, it is upon the trainer to align themselves, to gain some skills that will enable you adopt to this new system. It is important, I reiterate what the principal for RVTTI mentioned the other day, that probably once we are done with this pandemic, probably within the pandemic period and even after, maybe 30% or more of training will be conducted online. And therefore, it is good that we vision these changes and we understand where we are headed so that we are also not caught off guard. All of us should be ready for such change. Therefore, I want to encourage our trainers that even as we go through this training today, get what you are supposed to get, pass it on to the others. You could even organize such sessions, Zoom sessions and other online sessions so that you can pass the same message to your colleagues for you to be totally ready so that when we reopen, we do not encounter any challenges in our operations. Remember that the students, the trainees specifically, may not have had such opportunities for training, and so they will look up to you to guide them beyond the class teaching about other aspects like the COVID-19. There was also a mention the other day, and a reminder really from TVET concerning the online trainers registration. And I thought it is important. I remind our trainers this morning that it is significant and it is important that you register yourself with the TVET authority on their online platform. And I'm sure that the links and the information had been shared with all of us. So please ensure that you are not left behind in that exercise. So I want to wish you the very best as we move into the training session, because really it was not a KENAPCO meeting, it is a training session. And I'm sure all of us have been taken through the training, even as we speak to you today. We know the content, and it is very important for you to go through it. It will help us a lot. It will assist us a lot in settling, even as Mr. James said. You could have done 80%. It might help you to move to 90 or 100%. And so thank you all participants for coming on board. And thank you especially to our Secretary General, Ekrandungu, for organizing for this seminar and this training. And God bless you within the day, even as you go through the training. Thank you so much and have a good day.
Okay, thank you so much, Mr. Evans Omoyo, for those opening remarks. Allow me to now invite the Secretary General, KENAPCO, Madam Ekrandungu, to make her remarks. Karibu, Madam.
Okay, thank you, Anita. I truly appreciate. My apologies, I am not able to upload the video. So let me try. The host is asking me, let me see. It's telling me I can't start. I go back to settings, so maybe I have a challenge with that. So just allow me to speak. I'm sure you can see my image.
Kindly try starting the video. Kindly try starting.
I am not able to do it. It is saying fail to start video camera. Please select another video camera in settings, and I don't have two. So maybe it's the drivers in my laptop. So just allow me to proceed. I'm sure they can see my image, those that we have not met before. So my apologies for that. Technology fails. We are in a season whereby we have to embrace such challenges. Even our trainers, as they will be doing the online classes, such things are inevitable. So next time I'll try to have a spare laptop in the eventuality. First, allow me to really thank our hosts, RVTTI, and specifically the principal, Dr. Tano. We are so grateful for this opportunity and agreeing to share what you have really done. As we have seen it already, and it is good that our trainers also get to get this kind of training. I would really want also to thank our PS for those who are joining us, our trainers. We had our PS open this session. It was a privilege for KENAPCO, because this is a KENAPCO organized with the RVTTI and Private Authority. And we had the Director General, Dr. Langat, and Dr. Mulati. We had them present during our reopening, just to brief you that officially this is offered by government in the interest of making sure that nobody is left behind. And to reiterate, this is the first ever pandemic that we are having in Kenya during our lifetime, and especially my lifetime. So during the pandemic in Sierra Leone, the TVET sector became a champion in training others on how to go about the Ebola pandemic. So take this learning very seriously, because you will become the champions of COVID. The other side, we can borrow from how other countries have handled pandemics, and we need not to be left behind. The TVET sector drives the economy. We are the people who will drive the Vision 2030. When you look at the Big Four agenda, TVET is what is expected to develop the skills and to train. And you as the trainers, you are the people the president is depending on, because we are the people producing the labor that is required to drive this country to achieve its Vision 2030, to achieve the Africa Agenda 2063. So you are very, very important, and this is why government can take its initiative and its resources. We are truly grateful. Please, Mr. To, pass our gratitude to DG, though we will do that personally, Dr. Langat, for agreeing to use a few resources to train our trainers on these. We truly are appreciative. This moment, we are trying to flatten the curve of COVID-19. All of us are challenged because it is something that we have never experienced before, and something that some people think that it is a joke if you've not had anyone close to you catching COVID-19. For some of us who have interacted with people who have recovered from COVID-19, they have been near death, they have been in ICU. I've had like 3 friends. It is real, COVID-19 exists, it is lethal. And we thank God that at least the curve is flattening. So as we flatten the curve of COVID-19, we need not to flatten the curve of learning. So, and because of that, we are working together very closely with the government. We are working closely with CATI, even as we try to transition online. There are trainings going on. So this forum is specifically a case study of RVTTI. So if you have any questions about KENAPCO, we have our usual WhatsApp groups and our usual emails where you can channel the questions. For now, today it's learning. But we shall be communicating to you about the trainings on transitioning online, because UNESCO, in partnership with the ministry, they are helping us to set up an e-learning system at KTTC. KENAPCO is part of this technical team, and we need not to leave anyone behind. We are grateful for this kind of partnerships. So expect such communications, so that maybe as other institutions are transitioning online, everyone is not left behind. So that because the country is not waiting for us, things are still rolling, other sectors are moving forward, other sectors are working. So as we try to produce the labor that these other sectors need, we also need not to be left behind. So the DG on day 1, he requested all trainers to get registered. Kindly make sure that if you're a trainer, you are registered with TVETA, and we can come up with a pool of available trainers for the nation. We need also to get organized on these. So this is a very good public-private partnership, and I would really love to thank our PS, the Director General, Dr. Mulati, and everybody, and the entire Ministry of Science and Technology. And a big thank you to RVTTI for hosting us. So as Aristotle said, RVTTI, that we are what we repeatedly do. Excellence then is not an act, but a habit. So we are learning from you, excellence, and definitely we will also transition this to our private institutions, and we share whatever we have so that we can effect our law on public-private partnerships to greater heights and to greater levels. So thank you so much. And you're most welcome for this training. You can still invite somebody else. We are at 1:31, so that we all get trained, especially on how to be champions of COVID-19 and how to handle such cases in our institutions. So thank you so much, Anita, and I give it back to you.
Okay, thank you so much, Madam Ndungu, for the opening remarks. Next is our DTE, Director DTE. I don't know if he's around. I've tried looking for him and I'm not seeing him. Mr. Tom, are we going to have the Director DTE today? Mr. Tom Mulati.
Anita, I can see he was trying to call me. Let me call him back. I can get back to you.
Okay, thank you. Okay, members, just to wrap it up, or just to remind you, this is a training provided by TVETA in collaboration with RVTTI. It's a COVID-19 sensitization program towards reopening of our institutions. And as we wait for Madam Ekra to inform us whether we are going to have the Director DTE today on board, just to wrap it up, participants, Mr. James Chege began by telling us that if life gives you a lemon, you can make a lemonade out of it and enjoy. So we have COVID. Let's learn on how to fight it so that our livelihoods can go back to normalcy. Then Mr. Omoyo told us that we be flexible and be quick to adapt change. So this is where we are now. We have to be flexible. There's no turning back, so that we fight this pandemic and deal with the new normal, because now this is the new normal. Then Madam Ekra told us that we, as TVET, we are the people who will drive this country to the next level. So let's go ahead and learn what it takes so that we have what it takes to lead, or rather drive this country to the next level. As TVET institution, we are very important in this country. So thank you very much. So karibuni sana. We hope that you're going to learn from us, from Rift Valley Technical Training Institute. We were given this mandate by the ministry to just share what we've done so that we can all be at par and move ahead. So we've done trainings for the last 2 weeks now. We did for CATI, those are public institutions. Then we did also a training for the principals in KENAPCO. Yesterday we had other regions for KENAPCO. Today we have you guys from Mount Kenya, Rift Valley, Northeastern, and Western Nyanza region. So karibuni sana. Madam Ekra, do we have a word from the director? Before we proceed?
Yes, we have a word from the director. He's joining us shortly. I'll let you know when he's in.
Okay, thank you so much. Meanwhile, allow me to invite the next moderator of this session, who is Mr. Andrew Tor. Mr. Andrew Tor is the technical assistant in TVETA. Karibu sana, Mr. Tor, and proceed, even as we wait for the director.
Okay, thank you very much, Madam Anita. Let me also take this opportunity to recognize the presence of our director. We've been told is joining in shortly. I want to also recognize the presence of our Secretary General from KENAPCO, Madam Ekra Ndungu, the executive member of KENAPCO, Mr. Omoyo, the host principal, Dr. Tarno, represented here by Mr. Chege, the principals of TVET institutions under the umbrella of KENAPCO present, the members of other ministry officials, TVETA, from TVET, and also officials from TVET Authority present, and trainers present. Good morning, everybody. I want to welcome you to this session. I'll be moderating the session of presentations. And as you've been told, my name is Andrew Tor. I work in the TVET Authority as the technical assistant in the Office of the Director General. Just like my colleagues have said, this is a session, or this training is meant to actually enable you to share experiences with RVTTI, one of the public institutions that has done some ground towards in preparedness to reopening. So we want to share this so that we can also be able to do it in our own way. I know TVET institutions under KENAPCO have, we operate on different topographies or different backgrounds. But what we can do, we can be able to benchmark from what RVTT has done and be able also to do it on our own way so that we can be able to comply. RVTTI, I can see the director has already joined, and maybe Madam Ekra, I'll take it back to you so that you can welcome the director to make his remarks before we go to the presentations. Karibu, Madam Ekra, and I'll moderate the other part of presentations.
Okay, thank you, Mr. Andrew To. So my director, Director Technical Education, my apologies, my video is not on. I am not hiding, it's challenges that I'm having of technology, so my apologies for that. So you're most welcome. Thank you so much for making time for us. We do not take this for granted. Thank you so much, Mr. Tom Mulati, for your advices so that to make this happen. Just to bring you to speed, the last 2 days we had our principals, we had 237 principals present. Yesterday we had 167 trainers present, and today we have 137 trainers, and we are expecting more to keep on joining. So we are so grateful that you're not, your department and the State Department for State Vocation, led by our able PS, Dr. Julius Joan, that you are not leaving the private sector behind. We are so grateful for that, that the recognition that we do not have a public child and a private child is actualized, because we can see that you're including us in all that government is doing, especially to make TVET happen in this country. As an association, on behalf of the entire KENAPCO fraternity and family, we give you our promise that we shall stay compliant and we shall keep pushing the TVET agenda in the country, because TVET holds the economy for this nation. I had mentioned earlier that during the pandemic for Sierra Leone, the TVET sector became a champion in terms of training others, in terms of helping their country to fight the pandemic. So the TVET sector in this country, we are committed as private sector to do the same. This is why we are asking our trainers to learn so that we can disseminate this information on how to fight this pandemic together. So Mr. Mulati, we are so grateful, and without further ado, I would love to welcome you to make your remarks to us. Thank you for making time for us. I know it is within a very tight schedule. Your day is very tight, so we do not take your few minutes for granted. You're most welcome.
Thank you. I want to appreciate the Secretary General KENAPCO for that moment that she has given me to speak to this TVET fraternity. Also wish to first and foremost also appreciate River Technical Training Institute for giving us this kind of information that is quite, and they're helping in terms of where we are today. Thank you, Mr. Andrew Doe, for guiding the process throughout the day today. I wish you all the best. My remarks are brief, but I want to really encourage all that are in attendance today. This is a class like any other class, and the goodness is that with this kind of application, the record is well kept of who attended from where to when. And therefore, we are counting on these members who have been recorded on this platform today to help us in the TVET response to the COVID-19 pandemic by being champions in their respective institutions. While the principals or the heads of institutions are struggling on raising money and purchasing this or that, they could get busy and they could get overwhelmed. But this group that we are training, we expect that you will be the champions who will ensure that our institutions adhere to the COVID-19 protocols that are necessary for us to alleviate any possibility of TVET institution being rated as one where there is a rapid or infections are being passed on from one person to the other carelessly. So we expect that you will take utmost protection to the learners by being active, by sensitizing the learners, and by making the provisions which are being communicated to all of us today. Now, in the COVID-19 response protocols that we are sharing from this presentation, we are not going in for high cost. We are going in for that which is cheap and functional. And when you look at the diagrams and when you look at the pictures, try and see how you can make it cheap and functional. And that is, I think, also why we chose on River Triangle Training Institute. We have been to other places who have done monuments of walls and big things in terms of washing points, which we did not really see as sustainable. But we have chosen this because we know that the kind of presentation that they are making is cheap, and you can even make it even cheaper, and as long as it remains functional. So I want to really say that it's a learning process. It doesn't mean that it is cast on stone. Whatever River Technology Institute has done, any other institution, whether private or public, can also do a documentary of their own institution and put it at an accessible point so that when the learners come in, they are able to go through the induction with ease. As you are aware, when reopening is in the vicinity, it will be a requirement that all trainers come to our institutions and they are taken through a training of this COVID-19 protocol, sensitization, because they'll be on the forefront of managing the learners in terms of teaching and also in terms of adherence to the COVID-19 protocols. So this team, again, will be used as trainers of trainers to train the other staff on how life is going to be in a TVET institution post-COVID or during this era of COVID-19 pandemic. And therefore, you are very important people. And I know that whatever assignment you'll be given in your respective institutions, you'll be assigned in writing, and therefore take the training seriously because it's a responsibility that is about life and death. I know that earlier on we were saying that the nurses and the doctors are our frontline soldiers, and indeed they still are even up to today. But for us in the TVET sector, you are our frontline soldiers. You are the people who are going to ensure that TVET is responsive to COVID-19 pandemic threat and is able to overcome and go beyond the COVID-19 pandemic and continue with the training. With those few remarks, I want to really say that as ECRA has really echoed and they continue to echo, there is no student who is public and another one who is private. And we expect a lot of harmony between the public and the private, a lot of collaboration. And that is what we are working on with ECRA, with Glory Mutungi, the chair Kati, so that there can be a lot of harmony at the regions. We are aligning the regions so that they are all aligned together. And so that whatever happens in the public, the private can also be able to share with the public across board. Whatever equipment we have put in the public institutions, it comes even from taxes which have been paid by the student and the entrepreneur in the private sector. And therefore we are looking at leveling the ground and making it a more cohesive synergy between the public and private institutions in the utilization of equipment that we have in our institutions and in the utilization of the opportunities that there are. And as I talk about opportunities, even the private sector, we will wish that they move into the areas like sports and recreation so that we are able to share TVET fair contests or science and innovation contests. We should see both public and private on the same platform. And that is the way to go. So I want to thank you, and I want to assure you that the Ministry of Education is very keen. From the CS statement when we were at Sagana, is very keen that going forward, if any time the CS will go out, he did say that he visits 2 public institutions and 2 private institutions. That was the declaration of the CS last week, and therefore we are preparing you, move fast because the curve is quickly flattening, and adhere to these protocols so that when the CS comes to your institution, you will not mince your words, you will quickly indeed show what you have done. Thank you so much, and I am with you all the way. Thank you so much.
Thank you, thank you. Thank you, our director, Mr. Tom Mulati. Thank you so much. we were now to the point of presentations, and I maybe before we go to that point, I also wanted to really thank the director for those remarks, and I want to say that from the TVET authority, like I said, we really want to work as a team, both public and private sector, because we play the same role in training the Kenyan youth. The TVET authority also is working very hard to ensure that that training that that is offered also meets the set standards. Yesterday we had one of the managers, but I think today she's slightly engaged, and she said that she's lining up a number of trainings, or there are a number of trainings that will be offered to you in order to build your capacity, so that you can be able to train to the required standards. When you go to the TVET website, there are a number of standards that have been put in place, and these standards will be able to guide you. The standards on leadership and governance, physical resources, human resource, trainee support, curriculum, curriculum delivery, innovation, research and development, and all these are actually meant to guide you on the kind of training that that you're supposed to offer. All this is packaged into a quality management manual that you can be able to get in the website of TVET. Similarly, for this compliance, you can also, through your principals, you can also get to the TVET website and be able to download the checklist with all these items and be able to use it to guide you in terms of preparedness towards this reopening. You heard from the director that now that we pray and hope that the trend continues in terms of flattening the curve, reopening will be in the vicinity anytime soon. So therefore, we would wish to ensure that all of us, the TVET family, both public and private, are ready, because if we are to reopen, we must reopen all at one go, because of the fact that we offer the same curricula. Our students are trainees registered for the same exam or are going to do the same exam, and will not say this group will open and others will not. I think we need to all of us to get ready, because of the fact that we train the same the students that sit for the same exams. So maybe as we go through this, I want to encourage that we also utilize the chat session to ask questions during this training, so that at the end we'll be able to share and respond to these questions. Now, I'll be able to moderate 3 sessions. One will be a first session that will be presided over, will be moderated. We'll have a presentation on medical overview of COVID-19 pandemic. That is for us to be able to understand the disease, this disease that we're fighting. Like the director said, as soon as we reopen, we do not want our institutions to be centers of spread, or what you call the hotspots. So the training is meant to give us the basics of the disease in terms of transmission prevention, so that it will be able to benefit our staff and trainees. The second presentation will be done by Mr. James Chege on behalf of the Chief Principal RVTTI, Dr. Egdo Interno, and it will take us through the institution. It will be able to expose us to how the institution have been able to interpret the checklist as given by the Minister of Education and what they have done, and we'll be able to share more. And then a third presentation will be a video narration by Mr. Richard Lukuyu. The video will also be able to take us a walk through the institution, from the gate to all the other places, the offices, the classrooms, the workshops, so that we can be able to see what they've done in terms of getting ready for this reopening. All this, like it was said, is a benchmark. the director has said, you can do it in a very simpler, cost-effective way in your institutions, because we know most of the private institutions are either in town within commercial buildings, and therefore the setup might be different. So, but you can still be able to do it in your own way to be able to achieve the required, to meet the required standards as the compliance dictates. So otherwise, I want to, on this onset, invite Dr. Naomi Kaino, a member of Singishu County Medical Team, to be able to take us through the medical overview on the basics of COVID-19 so that we understand this disease and be able to internalize what kind of enemy that we are trying to fight. So, karibu sana daktari.
Thank you so much, members, for coming, for participating. I will take you through the coronavirus disease. That is section one, basics on COVID-19 pandemic. So I'm going to take you through the slides. I want to share with you the slides. Then we can check. Mr. Toy, is it clear?
Daktari, yeah, that is now okay.
Okay. Thank you so much, members. Allow me to share my...
Go to the beginning now.
Yes. Allow me to share the screen so that we can go together. I'm going to take you through section one, basic on COVID-19 pandemic. We are going to learn, all of us, as a medic, we are still learning this disease, and we are grateful that all of you are on board, so that at least if you have an idea, we can share, we can learn together. So what we are going to do is we want to see the contents. What is coronavirus disease? That is definition, where did it come from? The transmission of the disease, how is it transmitted? All of you know. Symptoms of the disease, signs and symptoms. Epidemiology, that is the occurrence. Reproduction number, how many people can one person infect? Then we see the infection prevention control, whereby we will know how to do, this one we will know how to go about it, how to prevent it. Then we go to psychosocial support. We need support for those who are affected and infected. So we will look at it. So what is COVID-19, members? This is coronavirus disease 2019. It is an illness caused by severe acute respiratory syndrome. Actually, it normally affects the lower part of the respiratory system, that is the lungs. So it is normally known as SARS-CoV-2 or corona disease in short. It was identified in human in Wuhan city, China in late 2019. That one everybody knows. WHO declared it a pandemic on 11 March 2020. It is actually a coronavirus group of viruses, and it is it's sometimes a mild disease. You can get symptoms, and sometimes it is very little. You can. This one has taken so many people. I think we are about 500 and something deaths. So it is not a joke. We are trying to learn about it. So the transmission of the disease, how does it transmitted? All of you know through it is actually a communicable, meaning it is transmitted from one person to another. That is why we are told to keep distance. It is transferred by droplet transmission. That is through breath, cough, contact, coming into contact with surfaces which are already contaminated. So there is droplets. They can be direct contact, shaking hands, hugging. There is indirect contact, that is touching places that is already contaminated. So I know you all know the mode of transmission. You know how you can get the virus. So what are the symptoms? What are the signs and symptoms of this disease? We have fever above 38 degrees Celsius. That is why we are taking the parameters, the temperature parameters. at the gate or the main entrance. So we have fever, we have cough, actually dry cough, we have shortness of breath, we have sore throat or lack of taste, even lack of smell sometimes. We have headache, we have lethargy and myalgia. That is, you feel tired all the time, you feel the joints are aching. There is, nowadays we have diarrhea, which has come in. Actually, we are still learning this disease. It presents with different symptoms each and every time. So it is really a challenge for us as doctors, but we are trying to fight it. So there is what we call case definition. Case definition for COVID-19. What is a suspect case? When you say this is a suspect case, what do you mean by that? So a patient with an acute respiratory illness, he has fever, cough, or shortness of breath, and having been in contact with a confirmed COVID-19 case in the last 14 days prior to the symptoms onset. So we call you a suspect case or a suspected case. So what is a probable case? This is the terms that are being used normally most of the time. Probable case is a case that we have high suspicion that this person is COVID positive, but we have not yet tested, or the testing is not inconclusive. So a suspect case for whom testing could not be performed for any reason, or for whom testing is it is not yet done, but at least it's a probable case. So what do we mean by a confirmed case? When we say this is a confirmed case, it's a COVID positive, it's a person who has already been confirmed by laboratory confirmation, irrespective of clinical signs or symptoms. Sometimes we can confirm a person that is a COVID positive, but is not presenting with the signs and symptoms. That is a challenge for us also, but we are thanking God, at least the curve is at least flattening, and we thank God for that. So what happens when we say we have a suspect case, especially in our institution? This is a challenge that we all will face, I think, when we will open the schools. So when a person comes in with and you feel that this is a suspected case, how do you detect it? What do you do? How do you go about it? How do you notify the institution? So we must look at a safety. We must be safe. When a person came in and we are suspecting that this case is a suspect case, you have high suspicion index. What do? We immediately don PPEs. We make sure we are well done, especially those people who are at a triage area, especially for those facilities, big facilities that there is one entrance. So there must be a triage area, an area that a person is taken beside, and then some of the other things are being screened. Then now when you have a high suspicion, then now you hand over that person, or that person is evacuated. So what do? You immediately don the PPEs, meaning you wear those masks, those gown, and then you isolate the patient. Isolate the patient, have an isolation unit. You will see at RBTTI what they have done. The slides will, you will see on the slides or even the video. You isolate the patient in a well-ventilated single room. If you don't have a single room, you can put a tent, and then you give the supportive care. So provide the suspected case with a face mask. Let her remove that mask, maybe as don't on a mask with a cloth mask. So allow him to remove that one. Maybe you can provide with a surgical mask. Then allow one person to handle that person throughout the process, so that at least when we are having a contact tracing, then we will know. Then avoid contact with your body parts. Please keep distance as much as you can, except to those people who might be helping that person around. So that is why we are restricting at least one person at a time to handle that as a suspect case. Then what do? We notify the institution when we have gone through the screening of that person, and we feel that this person might be having COVID. We notify the institutions. There is those county disease surveillance coordinators. There is those hotline that you are given when you feel you are unwell. You call. So you notify the institution for such person to be evacuated from that place. at least as soon as possible, so that it may not raise a lot of suspicion in school, and it might not be good for you. So then after notifying the institution the person has been evacuated, please do what we call confirmation. Confirm that that person is actually what you say it is. So the confirmation is done in the hospital, or it is done in the other institution. We cannot be able to be doing the confirmation because it will be a lot of work for us as an institution. So when that person it has been confirmed that he's positive or is a suspected case which have turned out to be a negative, then we do the documentation. We document, we say such and such a date, we get this documentation. I know you all know. And then we help in contact tracing and follow up. Contact tracing, who has come into contact with this person if actually is a COVID positive, so that at least a few people, it doesn't contract the all institution. So that is how you go about it. When you have a suspect case, you know now what you have to do and how you have to go about it. So safety handling a suspect case. No, we have done that one, sorry. So contact with COVID-19 patient by working together in close proximity, face-to-face contact within 1 minute for more than 15 minutes, traveling together in any conveyance, especially the matatus, living in the same household with a person who is a suspect case or a person who is already confirmed COVID positive, healthcare associated exposure for those who are in the healthcare sectors, or even if for someone who is okay and maybe went to the hospital, or maybe the person who is in the, so you can still get the virus. So what do we do to those people who have been confirmed? We quarantine them. Quarantining is just simply restricting the movement of the people, separating them. Those who are already exposed to a contagious disease. So maybe we have one self-quarantine. Self-quarantine is staying in your house. Maybe we have seen that we have been confirmed that maybe you came into contact with the person who is COVID positive. So we isolate you until at least a period of 14 days, so that we can know that at least you are safe also, so that you might not even infect the other people. So we do what we call self-quarantine. Then what we supervise quarantine is just supervising that person, especially those facilities that are offering supervised quarantine, especially those who are COVID positive, and maybe they are presenting with a lot of symptoms, difficulty in breathing. We have to really supervise and see that they are all okay. So what do you do when these people are being quarantined? You do what we call monitor body temperature daily. We do monitoring of the body temperature daily. In fact, they go ahead and have their own thermometer so that they might be checking if it is at least coming down. So monitor symptoms daily. You know, symptoms as the disease progresses, there is a lot of symptoms coming in. Sometimes these symptoms that come in is difficulty in breathing or shortness of breath, which is very little, and people might die for this. So that if they have the difficulty in breathing, they know what to do. They call the hotlines, and maybe is taken back to be monitored in the hospital. They can be substituted by giving the oxygen, artificial oxygen. So if temperature rises or symptoms appear, seek medical attention immediately. That one we give their numbers, the numbers that when they are unwell, they call. So epidemiology, study of transmission, incidences, and frequency of a disease. If you see it is affecting all over the continent, almost all over. So this is a pandemic. That is why it is actually a pandemic disease. It is covering all over. So what do we do now as Kenyans? If we see now we have Kenya cases, we are actually the highest compared to the neighboring countries. Our neighboring countries, you know, Tanzania, Uganda, maybe we are at the highest. Kenya cases updated by 9 September 2020, you see we are at 36,460. Deaths is about 607. Recovered is about 21,557. This one we are a bit happy for this. At least many people are recovering from this. But this doesn't mean that we should we should not do the protocols that we have been given, the protocols that all of you know. Take it seriously so that at least we can flatten this curve and come back to school and at least continue with the life. So what is reproduction number? The measure of contagiousness of a virus, the number of people likely to be infected by one sick person. One sick person can infect about 2 to 2.5 people. So it is actually a contagious disease. That's why avoid 1.5 meters and stay safe. So infection prevention control chain. So here we are going to check the cause. The cause of this disease is a virus. You all know it is a coronavirus disease, RNA. Where does it stay? People, equipment. And then what is the portal of exit? How does it exit from the reservoir or from the people? It exits through the sputum, that is droplets, secretions. Who is transmitting it? Me and you, transmitting from one person to another. Portal of entry, how does it goes to you, to the susceptible host? It goes through the mucus, respiratory mucus membrane. That is why we normally cover our eyes, not even hide the nose and the mouth most of the time, so that at least we might not come into contact, even if we get from this portal of exit to, and then it is transmitted to the other person. At least you are well covered. You might not get it. So it goes to the susceptible host. Who is a susceptible host? Those people who are immunocompromised, age, acute or chronic condition. Those who have acute and chronic, especially diabetes, hypertension, cancer, HIV. So those are a susceptible hosts. So we have a role, all of us. Even if our health is okay, you might not, your immunity is good, please let us protect those who are susceptible. Let us be a apparatus keeper. Let us keep ourselves safe and keep our family safe. So infection prevention control, how do we control this disease? All of you know it. It is even in the media everywhere. So infection control is the practice of preventing or trying to stop the spread of the infection. What are we supposed to do? Rapid identification of a suspect case. Immediate isolation and referral for testing. That one we are safe. Safe clinical management. Handle that patient safely. Adherence to IPC practices. IPC practices, you all know. Cover your mouth with a mask. Maintain distance of about 1.5 meters apart. Wash your hands with soap. Or, do the sanitization if you don't, hand sanitizers if you don't have water around. Cover coughs, sneezes with the elbow. That is cough etiquette. That is you know it. If you don't want to do like this, then use the tissue and then at least they discard it nicely. Do not allow any person having fever with or without respiratory symptoms to report for work. If you are feeling unwell, please stay home. Frequently disinfect commonly contacted services, especially our offices when we come back. Avoid exchange of equipment. If actually exchange, please do what we call disinfection. Even the sharing of personal items, if you really want to share, please sanitize them or disinfect them. So that is the infection prevention control. You all know about it. Please keep on doing this. Maybe we can flatten this curve and we will be enjoying, all of us. So then what do we do? Now that we have known all these things, there is what we call psychosocial support. We support those people who are affected, who are infected. We need to have a counseling team well trained to handle this. We must be having those support team, even the spiritual leaders. We put them all so that they might help those people who are actually distressed. So prepare. So psychosocial first aid action principle. I'm just giving you an overview. I know you will go down and then see how you can manage this. So prepare, learn about the crisis event, learn about available services and support, the support teams that we have around, the clinical teams, learn about the safety and security concern. What are you supposed to do? And then look, observe for safety, observe for people with obvious urgent basic needs, observe for people with serious distress reaction, and please listen to them. Listen to the people and help them feel calm. Ask about people's needs and concern. Make contact with people who may need support. So, and then link these people. Help people address basic needs and assess services. Help people cope with problems. Give information, like the way we are doing. Connect people with loved ones and social support. Please support this patient. That is why we have a counseling team. People are everywhere stressed. People are distressed. People have many people have lost their livelihood. That is why even we need a support system. We need a system that at least if we have a suspected case at the gate, it might calm even the institution. Then it is okay. It has been handled. It come into contact. That even that person who is being in isolation unit, is already undergoing a lot of stress. So we must be having this team on board. So I think that is the end of my presentation. Thank you so much. God bless you. In case of any question we are discussing, please put it in chat section, and then we can go about it and help each other. Thank you so much. Back to you, Mr. Cho.
Great. Thank you, Dr. Ari, for that great presentation. Members, we can appreciate the presentation by giving an applaud. I think we have been shown how to do that. You just go to your reaction tab. Yes. Thank you, Frasha, Wangari, Nyongesa, and a number of you. I've seen Anita. Please, let's appreciate Dr. Ari for that good presentation. I think that now gives us a ground to be able to understand, the disease. And like she said, this is a new disease, that is a new enemy. It's that so many things, even scientists are still trying to find out as we go along. There's a lot of research. Thank you, Uma, for the appreciation. Thank you, Justus Kiprono, Jacqueline Nyambura, and Timothy Kiplagat, and many members for the presentation. So Dr. Ari will still be with us. If you have any question or any question that needs clarification, especially on the medical side, she'll be able to respond to at the end of the presentations during the plenary. Yes, I can see a lot of Asante Sana. There is Stephen Omare, Kiplagat Hillary, Geoffrey Kiprono, Andrew Thuo, Brian Matara, Alex Kanga, Timothy, and many others. Thank you so much. So I want also to say that these presentations that we're making will also be available on the website of RVTTI. If you go to the website, you'll see a tab just on the website on COVID-19 preparedness. When you click it, it will lead you to two things. One, it will lead you to a link where you click and you get the presentations. Similarly, you'll also click a link. There are two links there that will also lead you to a YouTube where you'll actually be able to play the video that will come at the end of this session. At the end of the three presentations, we'll have a plenary where we'll be able to discuss. So as we go along, please put your questions on the chat session. I've seen your reactions and your comments. And earlier on, the ICT guided that if you're using, I think there was a guide on how to get voice, because I've seen a number of you responding that they are not getting the voice. And she had said that if you're using a phone and unable to hear any sound, please click on the join audio, then select call over internet if you're using a phone. I think from our end here, you can see a number of people who are actually not not hearing. But we said for purposes of this training, ensure that your videos and the microphone has stopped so that you can hear from the presenter. So thank you for that session. We're going to move to the next session, and that would be a session that would be presented by Mr. James Chege, the Deputy Principal in charge of academics. He will be presenting this on behalf of Dr. Tarno, who is the Chief Principal of Rift Valley Technical Training Institute. They'll be able to share with us what they have done and how they have interpreted the checklist items from the first to the last item as a benchmark. So I want to, at this juncture, invite Mr. Chege so that he can be able to take us through the presentation. Karibu Bwana Chege.
Thank you, Mr. To. Karibuni members. My name is James Chege, as you have heard. I'm the Deputy Principal in charge of academics, Rift Valley Technical Training Institute. I'll be taking you through this session on behalf of the Chief Principal. And the journey we are taking you through started after we received the general guidelines and protocols for the reopening of TVET institutions, colleges. And accompanying those guidelines, there was a checklist that had 96 items. And our assumption is that you have all interacted with the guidelines and also the checklist, because what we are going to take you through is what was derived from the checklist. And when we looked at the checklist, we prepared, we started from there. That is the genesis of our preparations. And as we shall take you the journey that we went through, you will see the end result. And I want to say right from the beginning, this is a disclaimer that Rift Valley Technical Training Institute is just a case study. And the case study, ours, we tried to customize to our own situation, looking at the infrastructure we had and looking at the number of students that we have and how life would be in college once the students come back. So members, sometimes I say that benchmarking is good, but can also be frustrating. Frustrating in the sense that if you benchmark the product without getting the process, then it frustrates you because you look at the product and say, I cannot achieve this. But if you benchmark the process and you see how it goes to the product, then you will be able to learn a few things. And as we are moving, always have your mind to your institution. Look at your institution and see what you can take back to your institution, not to do it the way RVTTI has done it, because ours was based on what the infrastructure we had and the size of the institution. So members, let us look at the process, what you can do, and what you can take back to your college. As I said earlier, I know many of you have moved so fast. Some of you have already achieved the 100% or so you imagine, because you also imagined we had achieved all that, but we realized we had not done so much, but we are somewhere. So this is guide on COVID-19 preparedness actions that were taken by RVTTI. Next. So when we received the guidelines on institutional preparedness, we looked at the contents and divided the contents into 7 areas. The first area is leadership and management. The second area is resource provision. There is physical infrastructure, college grounds, continued learning, psychosocial support, parental engagement, and community involvement. And we shall be able to take you, I'll be able to take you through and show you how we interpreted all this and got our action plans and implemented them. Next. Leadership and management. The first item there is principle to appreciate COVID-19 pandemic. The head of the institution, who is the CEO, has to appreciate that COVID-19 pandemic is there. And as much as it is elsewhere, it can also come to your institution. So the moment you appreciate that, then you know how to go about it. But if you believe that it is not there, then you are likely not to do anything. Once you accept and appreciate, you will have to lead by example. And leading by example, you walk the talk. You do not tolerate negligence in the institution. And what we are saying here is that you people who are being trained here, if you are not the principal, then the assumption is you are very close there. And therefore you are assisting the principal in achieving what we shall be able to show you and what is there in order to combat the COVID-19 pandemic. On that photo down there, you can see that is our CS, Professor Magoha, when he visited the institution. And those are the hand washing stations that are just stationed outside the gate. He managed to wash his hands. He was flanked by the area MP and the chairman of the board and the principal there. We shall be able to demonstrate that one. You'll see it clearly how it looks like. Next. Still on leadership and management. Establish a COVID-19 preparedness team to tackle checklist items. This was the first step that we took. We had to come together as the top management of the institution and looked at the checklist items and looked at one by one. And having gone through the checklist items, we developed a costed plan. A costed plan is a budget and had it approved by the BOG. And once the BOG approved it, then we looked down amongst our staff that we can assign responsibilities. And once we assign responsibilities, we developed teams of 3 or 4 people to work on areas that we thought that can be dealt by specific people and come up with the implementation. And the principal was always there to monitor the implementation, not just assigning responsibilities and going away. You have to be there so that you monitor the implementation. Then we were required to liaise with the county COVID-19 response team, which we did, and we are very grateful to them because they were in handy, they have given us advice, and they were also visiting the institution to see what we were doing and could help us. Then we also got the support of the Minister of Health at the county level. And we were also working together with the Moi Teaching and Referral Hospital that were very close to us and very helpful. Next. Yes, leadership and management, communication. Members, you remember when we closed in March, nobody had prepared to close. And everybody went home. The trainers went home, the students went home. Now the question is, as we are talking today, do you know where your students are? Even as you are preparing for students to come back, are you sure that those students will come back? They are aware that you are still existing, considering what has been happening in the press when everybody is saying that so many institutions have closed. They may have thought that the institution will also closed like the others. So what you do is, we have a bulk SMS service. The bulk SMS service, we have been using the bulk SMS service to reach out to our students, to remind them that we are still there. And we are waiting for the opening to be declared, then they come back. So you have to keep on knowing what they are doing, and they have to know that you are there. And we have continued assuring them that we are preparing. We have also been using the WhatsApp service that is very common for communication nowadays. WhatsApp service, we may not be able to form a WhatsApp group for all the students. So what we have been using cells. Right from the dean's office, we have heads of departments, we have heads of sections, we have class representatives, we have students council. So any information can be able to flow using those groups, and even whatever we are doing in the institution, they get the photographs and they see that what we have done in the institution to assure them we are still there and we are waiting for them. We also have an active website that is active in the sense of active. It is updated very often on a daily basis. Anything that we have to put there, we put it. And that is how we have been able to communicate to our members of staff and also to our students and also to all the other stakeholders. Next. Still on communication. Communication on COVID-19 infection prevention and control to staff. I have said the staff, our teaching staff has a WhatsApp group, a very active group. Our non-teaching staff have also a very active WhatsApp group. We use that to communicate anything that we want to communicate, and the members of this WhatsApp group is from the top management to the smallest man. So we are able to communicate, interact, and exchange ideas. Trainees also have theirs. Like I've said, how the information flows to them and how the information can also flow back to us. Parents, we have been trying to get to them. That is using the bulk SMS. The community, the areas where students reside, because most of our students reside outside. Transport providers, including Boda Boda. These ones we use the leaflets. We have those posters that we have distributed to those places where students reside on COVID-19. That is communication, and they come from us. Service providers and suppliers. We have service providers to the institution. We have suppliers to the institution. When these people, when we open and the students come back, the service providers and the suppliers will always be interacting with the institute community. So we also need to sensitize them. So that one we have been doing. Training and constant sensitization of all staff. If you look at the checklist, item number 24, item number 32, and item number 79, they talk of sensitizing, training on prevention and the management of COVID-19 to all members of staff. So what we did, we liaised with the county response team and the Moi Teaching and Referral Hospital, and we had all our trainers and non-teaching staff trained. All the 260 plus were trained using a virtual training like what we are having this morning. And we can say that we have sensitized them, we have trained them on prevention, we have trained them on management. We can say they are all clear. Nobody have those myths about COVID-19. As they come back, they are aware of that. So that one we did, and it was one of the requirements, and therefore, and that is why, even as you are tackling those items, you can even tackle many of them by doing one thing. Because after training them, then we have covered sensitization, that is item number 24, 32, and 79. And of course, you keep a record of the same, just like we shall have a record of this training. Next. Back to college protocols. Students have always closed and come back to college. But when they come back to college, it is not business as usual. It is not the way they have been coming back to college. We always have, all colleges have rules and regulations. And now these rules and regulations have to change, because when we come back to college, there is a requirement of everyone should have a mask. There is a requirement of people should wash their hands. We have a requirement of we have to keep records of all those people who have to come to college. We have regulations that temperatures have to be measured. Like in the supermarkets, things changed. In the banks, things changed. In many offices, things changed. So even coming back to college, you need protocols that also are in line, that are aligned to COVID-19. And what we did is that from the college rules that we have added an addenda. So we have added those other requirements in order to meet keeping social distance, doing all this, washing your hands, all that we have added there, and having a mask all the time. Your temperature is taken at the gate and all that. The same applies to staff protocols. Training will not be the same as it has been before. The way they could intermingle in the staff room, that one, the protocols define how many people should be in the staff room depending on the space that is there, keeping in mind that there must be some social distance, and also the risk management protocols. Those ones have to be defined in back to college protocols, so that, like the director said, so that the colleges do not become a new epicenter of infections when students come back. Health and safety, this area here, you really need to deploy adequate trained personnel. Now, I'm aware institutions have dispensaries with the nurses and maybe clinical officers, and some colleges, I know there are colleges that are medical colleges here. There are colleges that are doing medical courses like pharmacy, medical lab, and other medical courses. Those people are adequately trained personnel in medical. You don't have to hire a doctor to come and do those things. You can use those people because they understand those things and also those prevention issues, and they will be of assistance to the institution. Isolation tent at main gate, this is a requirement. You are told this is a requirement. You need a place where you can isolate. Once you have taken the temperature of these people as they are coming in, if my temperature is found to be above normal, then I need to be kept somewhere so that I can be observed. Either the temperature comes down, if it persists, then assistance is good for me while I'm there, so that you avoid that person getting into the institution and mixing with the community in case that person is infected with COVID-19. Next. Posters for communication. This still under leadership and management. Posters. Posters is the best way of communicating. In our institutions, we have always known we communicate through memos, through notices, all that. So in this case, we need to communicate COVID-19 messages. So we have visibly mounted notices on screening of staff, trainees, and visitors, especially at the main gate where people are getting in. We have those posters that communicate all that: screening of staff, trainees, and visitors, hand hygiene and physical distancing. Those posters define that. Sorry. Mandatory donning of face masks, posters that tell you that you need to have your mask on once you are getting into the institution and throughout your stay in the institution. Then we have denial of entry to suspected COVID-19 cases. The use of denial should not disturb you, because what we mean by denial here is that if your temperature is taken and is found to be higher, what we do is we take you to the isolation tent or an observation tent where you are given time to rest, because if the temperature is higher, I'm aware you will know that some people come running to the institution because they are late. Some people may even be having malaria. Some people could, our institutions, most of them are on maybe the 7th floor. Somebody walking up there, so many things go up. Either even the blood pressure goes up, the temperature goes up. So once you realize that person has, you don't have to say, now this is a COVID case, let that person rest. And then that person, and that is why we talked of trained medical personnel who can be able to observe them and make a decision that this person needs assistance. Just like usually in colleges, we always have people who get maybe bouts of malaria, who get sick once in a while. And those people, the same assistance we give them, these ones will also need that assistance. So the location of these posters: at the main entrance, the gates, the administration offices, the classrooms, laboratories, workshops, library, hostels, dining hall, health center, everywhere. We shall be able to demonstrate this one in the documentary that will be shown later. You'll be able to see all these things that we are talking about here. We have them. Next. Good. That's the main gate. If you look on your right, top right, you can see a banner like the ones we use for crusades. The banner there is communicating COVID-19 messages. If you're driving in and you're in your vehicle, you can be able to see them. So they communicate that. If you look on your left, you can see that is a pillar at the gate, and the small gate at the extreme left is the pedestrian entrance. So that one, as you're getting in, you will see all these things. They are visibly mounted. They are big enough for anybody to read. No mask, no entry. That one tells you that. Mandatory hand washing. If you cannot read the hand washing, it is demonstrated there with the tap and your hands washing. So you can see all that, and you are directed where the hand washing stations are. They are just there. You will be able to see them in the documentary. Healthy first, stop, all that. Then you are told that your temperature will be taken there. Next. Next, please. Thank you. This is inside the institution. On your left, you can see their taps there. Those are hand washing stations, 2 of them. Those ones are strategically placed. There is no much human traffic from what we know, but we have put those hand washing basins so that anytime you are walking, you can wash your hands. And if you look at what is used to mount those basins and that water, that is the 2x2 metal tube that is easily acquired in the supermarket. It was fabricated in our workshop by our trainers and technicians. It's very simple technology. You really don't have to construct a concrete something there and put it there, because this one you can be able to move it if need arises without causing much damage and without being very expensive. So that is what we did, and it is good. And you can see the place can also be cleaned at the bottom. There is no water spilling because it is strategically, there is a sewer line down there, so the water just drains to the sewer, and there is also water supply that we could bring there, and it is there. If you look on your right, you can see that's a wall, and that is a very big poster. It is 4x6 feet. So it is big, you can be able to see, it is attractive. You can see it has so many colors, so that attracts the eye. You look, you read, you see. If you can't read the blue one, you can see the white one, you can see the demonstrations. And down there, you can see RVTTI cares for you. Even as you are giving all these warnings, you still tell them that RVTTI cares for you. It is not that we are punishing anybody. Next. That is the entrance to the dining hall. That's the dining hall door. You can see on the dining hall door, on your right, there is a notice to students. On your left, there are also others that shows how you put on your mask, your mask should be not on the chin, not covering the mouth only and leaving the nose. And then there are things there you read there. And also down there, you can see there is temperature screening station. We shall place somebody with a thermal gun the conventional thermogun that we use to be taking the temperatures anytime anybody is getting into the dining hall. The reason for this is that we have students who stay in the hostels. And when they wake up in the morning, you may not require them to go outside the gate, then their temperature is taken, then they come back. So because definitely they'll go to the dining hall, so we take their temperature there. That is why we have that station there. Next. Yes, you can see still on signage and posters on your left. That is the entrance to our library. You can be able to see there is a staircase on the extreme left. That is staircase goes to the upper part. And you can see there is a poster there. That poster is communicating a specific message that is for that place. We are always tempted to catch the handrails as we are climbing the stairs or as we are going through the ramp. So what you do is you still put a sign that tells people to avoid catching the walls and also the handrails because of COVID. So that is the message that is there, that is relevant for that place. Down there, that is the counter that people leave their bags as they are getting into the library. And you can see down there, you can see where those people you are supposed to stand as you're handing in your bag. There are two people who are there who will receive your bags. And then as you're getting into the library, it is very small. There is a very small automatic hand sanitizer dispenser there. It's a very small one that you don't touch. All you need to do after handing in your bag, all you need is to put your hand there and the sanitizer is dispensed. You do whatever you are supposed to do and then you get into the library. In the library, there are also protocols. Inside there, you will be able to see that. On your right, you can see TechnoCafe. TechnoCafe is where students go to buy their snacks and maybe food, all that. And that place, we have also put posters that still communicate the same message. The idea is, from one point to the next point, there should be posters that still remind you, not just at the gate, then once you are inside, then the story ended at the gate and the life continues inside. So everywhere there are posters that are relevant to that area. Next, please. Yes, that is Nyando. Nyando is a hostel and Nyando is in reference to a river. I think it must be in Kisumu district. That one was put there around the 1960s. If you look at that, is the entrance to the hostel. And you can see also there are posters there, instructions to students. And under Nyando, you can also see their instructions on how you should put on your mask. On your right, you can see that is the medical center, otherwise known as the dispensary. Traditionally, it was a dispensary, but today it's a medical center. That is where students go. So again, on the entrance to the medical center, we have a poster there that still communicates the same COVID-19 messages. Next. Good. On your top left, you can see that photograph. That is inside a classroom. Inside the classroom, we have put posters at the front there. You can see on your left, there is the whiteboard. After that whiteboard, there is the poster there. So that when students are inside the classroom, the messages are still there for them to see. If you look at the whole classroom, even on the wall on the side, there's still another poster that still communicates COVID-19 messages. That is the CS, when he visited the institution, he was reading what we have there in that poster. If you look at down there, Under that photo where there is that parking, you can see that is a notice board, a mobile notice board. Still, the mobile notice board has been populated with posters on COVID-19. Then on your right, you can see keep our workplace safe. This is outside the administration offices, meant for the people working in the administration office and the people who will be able to get there. So administrative offices, you still communicate the same messages that are relevant there. Practice good hygiene, stay home if you are feeling unwell, limit meetings and non-essential travels. That is relevant to the administrative offices. Next. And that poster is very big, so you cannot avoid to see it. The idea here is if you're making posters, let them be large enough, maybe laminate them, because if you decide to photocopy on A4 paper, nobody is likely to look at that. So the posters have to be attractive. They should attract the eyes. They should be large enough for anybody to read, and that way. So that is the revenue office. Revenue office is where almost everybody congregates at one time or another. And sometimes the place is crowded. So you can see there is notice to students and guardians what they need to do to avoid overcrowding there or visiting that place always. Use the students portal to confirm your fees payments. Students can confirm their fee payments and balances and other services from their students portal that is also active. Keep your bank paying slip safely as evidence of fee payments. So they have to keep their bank slips, the paying slips safely, because once they deposit the money, it updates automatically in their account. So they need that one as evidence. Receipts shall be collected from the prospective departments. Inquiries should be channeled through the heads of departments and help queries, all that. Then you can see symptoms and signs and symptoms. Those are the safety measures. So you have all that at the revenue office. Next. Resource provision. Temperature guns. These ones, we have known them since March. We always knew that they existed only in hospitals. Now they are everywhere, the banks, the supermarkets, and many offices, entrance to any building. There we have those temperature guns. Speed face biometric readers with the temperature detection. Now this is what we have installed. When we looked at the population of our students, 5,000 plus, and one morning about 3,000 plus entering the institution, we realized that if you use the temperature guns that measures the temperature, that person who is doing it will also get tired. And the queue will be very long. There will be a very big jump. So we have installed a speed face biometric reader. What it does, it has 3 functions. One of the functions, it gets your face. It detects your face. That means once it reads your face, it is just like the thumb that we are using for biometric. So it has already recorded that you have arrived. It has recognized you and it has recorded you have arrived. It also reads your temperature. You only need to stop there. You'll see that one in the documentary. You just stop there, then it just reads your temperature and writes your temperature there. And it also communicates that your temperature is normal. And it also detects whether you have your mask. If your mask is properly put, it will tell you your mask is good, or it does not tell you. But if it is not properly, if you are not putting on a mask, it will tell you put your mask on. If you have put your mask where we usually put under the chin or just covering the mouth and leaving the nose, then it will tell you that your mask is not properly put on. And then it will make noise. So whoever is standing there, the security guys will know that this person. So it makes the work easier, and the flow of traffic is easier. It takes 3 seconds, not more than 3 seconds to detect all that and allow you in. Then we have adequate hand washing points at the main entrance to college. We have enough to avoid crowding. We have about 20 of them. On either side, you'll be able to see them where people can be able to wash. And we have also installed automatic soap dispenser. So we don't have the soap of the other one that you have to keep on sharing. So it is just automatic soap dispenser. You do it, and the taps are push taps. You push the tap, then you wash, and then it stops itself. Then you just walk away. So we have that one. At entrance to classrooms, workshop blocks, the requirement is 1 water station per 50 trainees. So you just need to calculate how many trainees you have, and then look at the water points that you have and how much you need to add. At entrance to dining hall, you'll be able to see that in ablution facilities, that is common. You cannot have an ablution facility without water. Next. Good. Now that's the demonstration of what I've just talked about, the temperature screening. You can see on your left, there is a gadget there. That gadget that is installed there. That machine checks your identification, your body temperature, and proper wearing of the mask. Those are the 3 functions. You can see on your right, face recognition, temperature measurement terminal. You can see that lady, that is how it looks like. That lady putting on her mask very properly. There is the detection that is up there. There is the camera, the infrared, that it detects your temperature. And even the screen also will be able to communicate to you. You can see the mic is down there that tells you all those things that I've mentioned. So down there, we have the conventional thermogun that we know. We shall also use those ones for people who are coming in with their vehicles. The people driving in, you don't have to tell them to walk out, then their temperature is taken, then they go back to their vehicles. That one will be taken. It is convenient for them. Next. Yes, still under resource provision, sufficient supply of clean running water. You can see running water is bold. In other words, the water has to be running, not water in a basin that you wash there, then the next person washes, the next person washes using the same. So it has to be clean running water. You can have potable treated water supply, storage tanks, of course with the proper plumbing works. So we have water that is supplied to the kitchen and the dining hall, hostels and ablution facilities, the classrooms, workshops and laboratories, offices and the staff rooms. Now, for classrooms, because when we show you the demo, you may look for the water station inside the classroom and not get it. We don't have them in the classrooms. We have enough water stations outside the classrooms. Because if we were to install them inside the classrooms, then you'll need to demolish almost everything for proper plumbing and proper disposal of that water. In the offices, we also don't have water. What we have are automatic hand sanitizer dispensers. You'll be able to see we have installed all of them in the offices. Outside the offices, inside the offices, we have the ones that we always conveniently use elsewhere, even inside our vehicles. So we have those ones. Next. Yes, that one is just a demonstration of the clean running water that we have in the institution. On top there, we have a borehole that we did about 5 years ago. That is the treatment plant for the water, and that is the tank that supplies to the institution, supplementing the water or complementing the water we get from Eldoret Water and Sewerage Company. On your right there, on top right, you can see that is the inside the treatment plant. Those are the gadgets that treat the chemicals. Down there, this is what I was saying, the hand washing stations just outside the gate. That is, you can see the shed was not there. We have put the shed. We have installed those taps there. There are 20 of them, about 10 on either side, so that people can wash. You can see there is something that separates this side and the other side with the messages there. That place used to be grass and some flowers. So when we got the checklist, we interpreted it and saw that that was the most appropriate place. And if you look at that place, you would imagine that that place was meant for that. If you look on your right, bottom right, you can see we still have installed some 3 water stations. In fact, there are 4. Those ones are strategically placed. You can see people can be resting on the grass there and the other side. And therefore, once you wake up and you want to wash your hands, you wash your hands there and you go. There is water supply that place, and there is also the drainage system. The water goes away. Next. Next, please. Thank you. That was as we were installing the hand washing station at the gate. That one is at close range. That is what we have done. What here we want to demonstrate is the structure, what we did, the structure there. You can see the basin is just placed. We have put those tubes, the metals fabricated, then the plumbing work of how it works, and also the push taps. These push taps, you only need to push, then it dispenses water. But we realized the requirement is 20 seconds and above, but this one can only be open for about 12 seconds. So what you do is, once you push once, you will have washed your hands, then it will stop, depending on the pressure of the water. Then you push again, then you clear your 20 plus seconds. Then after you have cleared your 20 plus seconds, you walk away. You don't touch it again. Somebody said that, why should you keep on touching it? You touch it at the beginning, but once you are done, it stops itself and you walk away. So thank you. Let's move. Next. Thank you. Physical infrastructure, physical distancing in the classroom spacing. Here, in the classroom, the requirement is 1.5 meters from head to head. Not it is from head to head. Not so much from chair to chair, because you realize we have chairs that are of different sizes. You can have a very big chair. You can have very small chair. So if you look at from chair to chair, then it will not be uniform. But one thing remains constant. When you are seated and I'm seated, the distance should be 1 meter, 1.5 meters, sorry. Then at the front, where the trainer operates near the board and the wall there should be 2 meters between the wall and the first student. You will be able to see that one later. Then signage on COVID safety in every class. That one, I said that you saw the CS looking at the signage in the class. Then scheduling of learning to avoid, I've gone back, sir. Mbele kidogo. Yes, that's where we are. Scheduling of learning to avoid crowding. You can use shifts, use of tents to supplement classrooms. Scheduling of learning to avoid crowding. you will realize after taking all these measurements, a class that could have take maybe 40 students now can be able to accommodate only 20. Therefore, you'll be able to schedule your classes so that you accommodate your students and you use the facilities that you have optimally, both the physical and also human, so that you are able to do that. This one I want to give it to private colleges because when it comes to using resources, they are very good. Even scheduling of the timetables, they are very good because I know most of them pay rent for their premises, and you cannot pay rent, then you have a whole classroom empty from morning to Sakumi. So you are able to schedule classes very well. So this one you can be able to do it very well. Disinfect classrooms daily. We shall be able to show you that because our classes are many, we have a fumigation machine. It's more or less like a gun, a bazooka, that we use to fumigate the classes. It will be shown, you'll see how it works and the guy who does it. Adequate ventilation and lighting. If a room was designed to be a classroom, there are those requirements from the Ministry of Education on ventilation and lighting. So windows are supposed to be openable. Then there should be enough lighting, preferably natural light. But if you cannot be able to get the natural light, even the electricity light can be able. That's the requirement. Ventilation is good because air should be able to circulate so that the virus does not spread in a crowded place without air circulating. Next. That is one of the classrooms. You can see the CS was very particular in the distance between head to head, not so much between chair to chair, because chairs are of different sizes. So he measured and said that was good. So that one we got 100% on what we had marked. You'll be able to see the markings we have placed on the floor so that the chair can be there. There will be no guesswork. It's not guesswork that the teacher looks at and says, now I think this one is this, weka kiti hapa, weka kiti pale. So it has to be very clear. And then you are able to know the capacity of that classroom. Next. Still on the same job of measuring, you can see the measuring now. This is the distance now horizontally. The other one was towards the front. So this one is so, and he was happy with that with his team. Next. So you can also see that classroom. There is a poster on the side. The other one was in the front. This one is on the side. So that if you sit there, you can always see any direction you see, you'll be able to see posters that communicate. Next. Yes, now that is the classroom as it is. You can see the chairs. You can see the tape down there. That tape is these reflective tapes that are available in the shops. And the floor is terrazzo. It's not terrazzo, it is tiles. So that one fits in very well. If it is terrazzo, terrazzo cannot get this tape. So what you do is you use the paint. So that is the classroom after arranging the way it should be. So you can see that classroom now occupies less number of students, unlike before, where every space in between would have had a chair. On your right, you can see that is a hostel room that could occupy 4 students. Today, it cannot occupy 4 students. You can only have 2 students there. As you can see, the lower bed on your right and the upper bed on your left. Now, that is what we were advised, because the distance between the 2 beds down there, the distance between the 2 beds is less than 1.5 meters. So if it is less than 1.5 meters, you can only occupy the upper decker and the lower bed this side. If it is more than 1.5 meters or 1.5, then you can occupy the 2 lower beds without the upper beds, unless you can achieve that distance of 1.5 meters, but their conventional deckers do not have 1.5 meter distance. Next. That's the dining hall. That is the dining hall as it were. And taking care of the social distancing, physical distancing, we have the benches that those benches could occupy as many as students could be able to squeeze themselves, depending on what they wanted to do there. And when we looked at the distance again, where you see the ticks, that is where we decided that one student will sit there. On your left, you can see we can only have 2 students. On your right, you can only have 1 because there is 1 tick. The X says don't sit here. But now the question is, where you have put that X, what stops anybody from sitting? Unless you have somebody to police that. But students will always sit. So the best thing is to remove that. So after that, we are in the process of removing those benches and having chairs. So on that one, we shall have only 3 chairs. Otherwise, you leave the bench that way, they will always sit there. Next. So we have demonstrated that to show that we thought we were right there, but we were told we are not right. So we have to get it right. Those are the workshops. The workshops there, you can see the markings. The markings there were there before. It's not that we have put them there now. They were there, and the workstations, all the workstations were marked where the machines are and where you pass and where you don't cross. We know the yellow line always says don't cross, and that is what we had. That one was okay. We did not have to redo it. The other side, the carpentry workshop, the demonstration there is the COVID-19 pandemic poster there. At the bottom there, that is the entrance to the dining hall. You will see it in the video where we have put those stickers on the floor, just like we have them in the supermarkets, where you are told stop here while you are waiting for the next person to move on. On the other side, you can see the poster that is entrance to the hospitality and athletics management department. So the poster is there while we have others inside. Next. Still on physical infrastructure, the toilets. The standard ratio for toilets is 1 to 20 for ladies and 1 to 25 for gents plus a urinal. So compute and comply. That is the requirement. So depending on the number of students you have and the number of toilets you have in existence, you just compute and comply. So the toilets that you have should have adequate supply of cleaning and disinfection materials. That is standard. Toilets should be able to be cleaned and disinfected. Adequate running water, adequate soap and approved hand washing detergents. These ones are provided by the institution. If you tell people to come with their soap and hand washing detergents in the toilets, they will not. Then sanitary disposal provision for ladies. This one is standard, has always been there, is usually a requirement. So you need that one, but this time it's only that. We just have to do it better than we have been doing it before, because toilets could be a very good source of infections. Next. Yes, the college grounds. College grounds is the college compound. Depending on how your college is situated, there are those who may not have even the college grounds. There are those who have grounds, and depending on the size, we are saying that the perimeter should be secured so that entry and exit into the institute is strictly controlled. Because if you have so many entries, then you will have to deploy so much resources, because you'll need to take their temperature, you'll need to record all persons entering and exiting, and it will be so much. And for this one, even if the institution does not even have a fence, at least there is an entrance where people follow. So that is no panya routes. So screening at all points of entry. If you have 2 points of entry, then screening should be done at all those points of entry. If you have one, the better. But I know most institutions always have one main gate. So you can do away with the others and people use one so that you are sure that those who come in have been screened. Record of all persons entering and exiting shall be maintained. We have seen that for us, we have installed that face detector. The compound shall be clean and well maintained. You'll be able to see how we have made sure our compound is clean and well maintained. The pathways shall be clearly marked. Depends on whether you have paths. For us, ours are not paths, ours are roads. Because when our population went up, we had to expand the paths that we had to make them roads so that there was ease of movement. And we also increased the paths so that we don't have congestion in one place, because we believe the distance between 2 points is a straight line. So we always looked for those straight lines and paved the paths so that it is easier to move and remove congestion in one path in the institution. The no physical contact spots. If you look at the guidelines on page 12, that is section 9 on co-curricular activities, that is the sporting activities, we are asked not to have no physical contact sports like football, rugby, maybe wrestling, all those sports that people will be able to touch each other. You can have athletics, that is running, jogging, all those are the ones that the guidelines insist should be there until otherwise advised. Next. Next, please. Yes, now you can see that is what I was saying, that the compound should be clean and well maintained. That is our compound. You can see all those buildings. Those buildings, many of them are as old as 1962. And you can see the paths, what I've called the roads, those ones that are not tarmacked, have the cabro stones. And there are many enough so that there is ease of movement, and it is also clean so that you cannot even drop even a sweet wrapper. Because if it is dirty, that is where people tend to, every place is a dump site. And we have bins strategically placed so that you can be able to drop your waste papers and waste, everything waste there. Next. I mentioned that we have a fumigation machine. That is the thing. You can see that guy is as PPE, and that is our tuition complex where most of our classes are. So we have planned that we shall be using this at the end of every day. Once that class leaves, then the class is fumigated. You'll be able to see how that fumigation is done, and the fumes make sure that they disinfect the whole class. We have small ones for the offices. A small one that is portable, that also fumigates the office at the end of the day. Next. Continued learning. Timetables drawn to meet new normal. Yes, you know that timetables will have to be drawn to meet new normal, that considering the capacity you have for the classes. And as I said earlier, for us, we tried to work as much as possible. We looked at the timetable and the population of students we expect back, and looked at the facilities we have It is a game of matrix, the assignment problem, as you know it in linear programming. So we have to use the resources and look at and allocate. So we allocated, looked at the human resource, the rooms that we have and their capacity, both the classrooms, labs, workshops, and we found we can be able to do it, but we shall only need to add maybe about 3 or 4 tents to accommodate all of them. So that one we are okay. You can also use flexible and blended learning approaches that include train all trainers on technology, enable the learning, prepare digital content of theory lessons, and avail to learners through online platforms, determine best approaches to facilitate practical learning and assess competence, then you ensure no trainee is left behind. Now, this one is actually the way to go. From the messages we received in the morning, it looks like this one we have no other way. Today, members, I can see we are 136 in this meeting, and we are in different locations. If it was before March this year, we would have required to travel to one of the places. You have to travel for 2 days, be in a meeting from morning to Sanane, then travel at night, travel during the day, spend a lot of resources. And today we are able to attend. I'm sure if this meeting had been called, we congregate in Nairobi, we would only be maybe about 50 because of the resources that it would require. So, and you can see that we have been able to meet and we can be able to get the training, get all the facts as we would have gotten in face-to-face meeting. So even teaching and the training, especially for theory lessons, this is the way to go. And I can assure you, it is very easy and it is more economical. And once we embrace it, then we shall not need to have a lot of time. We can be able to do so much. In fact, twice as much as we would have done before, because even weekends we can be able to teach. In the evenings, we can be able to teach wherever any person is. So that is the way to go. We already have a Moodle platform that we have been using to train our students, though it is on a smaller scale. And I believe that the directorate is soon rolling out that one that will bring everybody on board, and therefore that is the way to go. So just prepare trainers. I know for private institutions, on these areas, you are far much ahead than the public institutions, because the public institutions, they are those ones that are still very traditional. Next. Still on continued learning, options available for online learning. We have the LMS learning management systems. We have the Moodle, the Google Suite. We have live streaming, Zoom, like this morning we are using Zoom and we are doing it very well. We have used the Google Meet, that is another option. There is YouTube and Facebook. The churches have been doing this. We have always been receiving sermons during the COVID time. Sermons as we would have received in a meeting, in a church, and we were blessed. So this is the way to go. There is also the Google Classroom. If we explore all this, we are able to deliver. And even the next pandemic that we don't know whether it will come or whether it will come in our lifetime, we shall be able to navigate it through without having to stay for 6 months or 1 year doing nothing. Next. Next, please. Psychosocial support, health and safety of trainees and also trainers. When we resume, it is very important to the health and safety of trainees and trainers is taken care of. Not only the trainees, we also need to take care of ourselves as trainers. It's not that we are the ones who can infect the trainees. It is not that the trainees can only infect each other, they can also infect us. So it is a community problem. So health and safety of all of us, hand hygiene, we have demonstrated how hand hygiene is use of face masks, training people on coughing etiquette. I think by now so many people have developed coughing etiquette. We don't cough everywhere that we go like we used to do before. We don't spit and throw those things anywhere. At least we are very careful how we do it. Enforced through posters and constant reminders like I have shown. Guidance and counseling the students and the trainers when they come back. They need guidance and counseling. The reason being that if you have not been infected, like Ekra said, those who have not seen anybody who has been infected believe that it is not there. Just like Africans we say, kama mtu hajawahi kufa kwenu, huwa mnafikiria watu tu wanakufa wapi? Kwa jirani, sio kwenu. But when it comes to you, that is when you realize that it really exists and it can only affect all. So we have trainers, we have trainees who are affected, even if they were not infected. And being affected is not because they had somebody who was infected. Since March, we have had so many businesses closing. We have had so many people losing their jobs, their sources of livelihoods. That one has affected almost everyone. The economy has gone down. So when these people come back, they will need a lot of counseling. People will be disturbed. They are not sick, but they are disturbed. They are not able to deliver. So we shall need guidance and counseling. You have seen so many, what they call gender-based violence in our homes. It does not only happen to other homes. It happens also to our homes, and it affects our students and our staff. So these people need qualified counselors. So what we did in our institution, we usually have one office for guidance and counseling with the counselor. We have dedicated 3 now with counselors. Luckily, amongst our staff, we have trained counselors. So if in your institution you have members of staff who are counselors, you can make use of them, and so that they will be able to assist in counseling all those people when they come back, the staff and the students. You can also use peer counselors. Peer counselors are counselors from the students' body, those who can be able to counsel their peers. Pastoral support, they will need pastoral support. This is a requirement. So we have set up a pastoral support team made of lecturers, and these are people who are able, drawn from the Adventists, the Protestants, the Catholics, the Muslims, that they chart a way of how they can reach their small congregations and be able to give them spiritual nourishment and whatever spiritual guidance they need. So we have constituted that. Next. Next, please. Parental engagement and community involvement. Establish reporting mechanism, engage local administration. Now, when students come back, 2 things will happen, or 2 things are likely to happen. We have parents, and we have students, and we have the institution. Today, you have even seen in the media, parents is saying, even if schools were to open today, I would not release my child. Why do they do that? Because they think when the child is at home is safer than at school or in college. So what we need to do is to engage the parents. And that is why I said right from the beginning, we have been able to engage the students and the parents to show them what we are doing in the institution, such that even the parents feel safe or feel free to release their students to us, because we have put in mechanisms, we have taken care of everything, that when they are inside, they feel that they are safe. Otherwise, if they don't feel that your institution is not safe, then I'll not release my child to come to your institution. And the children will also not want to go to that institution. There is community involvement. When students come back, they come from all over the country. And you have been hearing that there are hotspots. So the community also needs to be told that these students who have come back, they are safe. We are safe with them. The students also need to be assured that the community is safe so that when they come, they can be able to be integrated into the society. You have heard of stigmatization. If I come back to the institution and tell you I had COVID, what is your response? So that is the engagement we are talking about. So you establish that reporting mechanism to assure everybody that it is safe. Then you need to have a database of all trainee, parents, guardians, caregivers, and sponsors, details and contacts. This one is any institution that registers students always get this database, and you have it. And that is the database I said that earlier you can use to reach to your students. Otherwise, if I reach my students and you don't reach yours, then the assumption is you have already given up and I'm the one that, so you may even find that your students will move to my institution because my institution has continued assuring the students and yours just kept quiet from March, so you'll start from zero. With those very many remarks, members, I want to thank you very much. Asante. Next. That's the end of my presentation. Asanteni sana.
Okay, members. Asante sana. Thank you so much, Mr. Chege, for that wonderful presentation. Mr. Chege has been able to make a presentation, PowerPoint presentation, again, based, like I said, based on the checklist. This is based on the 96-item checklist, and you'll be able to see the 7 areas and how the checklist has been divided and how the institution has been able to interpret it and the actions have been taken. Asante sana. Let's give Mr. Chege a clap or a thumbs up. I've seen Asante from Dr. Naomi, from Anita, from George, and many others. Let's give Mr. Chege a thumbs up. Yes, George, thank you. Thank you for those, Stephen, and many others. Thank you so much for those thumbs up, for the congratulations. I want to say that is, at least you've seen what the institution has done. And like he said, every institution has, the setup in our institutions. Yes, James Kibe, thank you so much. Asante sana. Keep them coming. Keep the accolades. Keep the thumbs up. Yes, Ekra, can see. Thank you so much. From the chat session, I want to also to thank you. I've seen so many messages. Some saying that RVTTI, should have opened like yesterday. And I think, yes, RVTTI has really done a lot, but still we're waiting for the signal from the ministry, like the director said. Yes, thank you so much, Oyoko, Michael. Yes, there's a number of you have said it should have opened because of what they have done. Yes, but I said it should. The institution is waiting also to, once the green light is given, then they'll be able to reopen. But we said this, that since we are all TVET institutions and doing the same exams, we have no choice but all to be ready and to work to ensure that we get prepared based on the checklist. I want to repeat again that a number of you have asked about the presentation. I've said, I've given a guide on the chart. If you can be able to see that these presentations are already loaded on the RVTTI website, which is www.rvti.ac.ke. I would do that at the on the chat. It's www.rvti.ac.ke. If you go to that website, if you visit that website, www.rvti.ac.ke, just on the front of the website, you'll be able to see COVID-19 preparedness training. When you click it, it will lead you to the link. It will lead you to two sites. One, the site where you get the PowerPoint presentations, that is from the Dr. Keino, and also the video that will run on YouTube. So if you click on the video, it will lead you to run the video. So you can, a number have been asking how to get it, whether you can get as handout or via mails and what have you. I think to make it simpler, just get to the website of RVTI and you'll be able to, you can see, you can watch this, you can go through the slides over and over, you can watch it as you prepare. And thank you so much. I think that is it. Thank you again. I've seen a number of questions, a few questions directed to our medical professional, Dr. Naomi Keino, a number of questions again about the cost of the biometric, the chemical used, and a number of things on that. After the next presentation, we'll have, after this video that we're going to watch, we'll have a plenary where we'll be able to share ideas on those questions. So thank you for this session. And thank you for the comments. Yeah, you're saying wonderful presentation, exquisite presentation. I think it's been very good. So I think we will move on to the last session where I'll invite the MIS manager of RVTI, Mr. Charles, to run a video for 29 minutes. And then after that, we'll be able now to go to the plenary. We'll have to have a discussion. I think I've also seen one of my colleagues from TVET Authority, Mr. Julius Serem, whom we also work together to make sure that this runs. Maybe after the video, I'll be able to give him an opportunity to say jambo. But for now, please welcome to the video. The video will be able to concretize now what you've seen, to walk us through the institution, to see how those things that have been put in place have been implemented, by action. So welcome, Charles.
Rift Valley Technical Training Institute is a univoc center for the Eastern Central Africa, and it's also a center of excellence for the East African community. We have therefore made every effort to meet the requirements of the COVID preparedness in opening colleges as indicated by the World Health Organization and the Ministry of Education guidelines. We have therefore shared what we have done. There is always room for improvement. We ask you to improve as we also improve. Thank you.
At the gate, we have hand wash stations with automatic soap dispensers and push taps to minimize contact or manipulation of the taps. The water is piped from our main tanks, so it is clean, potable running water supplied by the Eldoret Water Company, Eldowas. It is expected that everybody should be able to go through the appropriate hand wash procedure that should take 20 seconds and ensure that the entire hand is properly cleaned in all cracks and crevices. Also at the gate, we have put notices advising visitors on the protocols that we have put in place, advising students and staff on what is expected of them when entering RVTTI. Notices expected at the gate include mandatory wearing of masks, mandatory hand washing at various places strategically located in the institute, use of hand-free alcohol-based sanitizers and hand wash stations with soap, visibly mounted notices on denial of entry of suspected COVID-19 cases, notices requiring all people to maintain the social distance of 1.5 meters or 6 feet as appropriate. We also advise that if people are feeling unwell, whether you're a staff or a student, you should stay at home and seek for medical attention. At the gate, we have also indicated that it is mandatory for your temperature to be screened because some of the checks that have been put in place to control COVID include temperature screening. The temperature checks, we have mounted speed face biometric detectors at the gate with face recognition, temperature detection, and face mask detection, all in one gadget. These have been positioned on either side of the gate to allow for easy flow of traffic of students into and out of the institute. So the marking has been indicated where you stand in order to have your temperature checked. The speed face detector will detect the face, enter the details into the data bank, so simultaneously you're able to register the data of all those that are entering into the institute. The speed face biodetectors will also detect if the person is wearing the mask properly. In case the mask is not properly worn, a warning beep will sound. If the temperature is abnormal, a warning beep will also sound. But if the temperature is normal, then the machine will indicate that the temperature is normal and welcome the person into the institute. In the absence of a speed face detector, it is also recommended to use the temperature guns because they are non-contact. So these ones also give a fairly accurate indication of the person's temperature. At the main entrance, it is important to have an isolation tent located there. This is simply because to avoid interruption with the activities of the institute in case a suspect case is identified and needs to be evacuated, it is convenient to have it located at as close as possible to the entrance. Within the institute premises, it is important that pathways where people walk and access the institute are wide enough to allow for easy movement of large volumes of people without crowding. It is also important that the grounds be well maintained because that appearance of cleanliness and hygiene will encourage the same behavior. Strategically located waste collection bins are also an important aspect in ensuring that cleanliness is maintained. Signage and posters are positioned strategically at every place to keep reminding people of the requirements and the expected practice so that in case they forget, the poster is there to remind them. As can be seen inside the administration block, there is an availability of alcohol-based hand sanitizer so that all visitors coming into the office can sanitize their hands before they get into the office. And as can be seen from the visitors coming in, the face masks are properly worn. Inside the offices, social distancing must also be maintained. In the RVTTI Deputy Principal's office, initially, it could accommodate up to 5 visitors comfortably seated, seeking attention of the Deputy Principal. But this has been changed now with only 2 chairs available, meaning that at any one time, a maximum of 2 people, maintaining the appropriate distance of 1.5 meters, can be in the office. The office is well lit and well ventilated to ensure that there is good circulation of air. This must be replicated in all the offices and even in staff rooms where appropriate signage should be put to indicate the maximum number of people that can be in at any one time. The social distance of 1.5 meters should be maintained at all times. Outside blocks, at strategic locations, signage has been put up to constantly remind all the staff and students of the expected behavior during this time. Water points for hand washing and even availability of clean drinking water have been distributed at strategic locations within classroom blocks, within laboratory areas, within workshops, to make sure that they are easily in reach at all points of the institute. And again, pathways are wide enough, well demarcated, maintained, so that there is easy flow of traffic. The library, a place where we expect academic pursuit of new knowledge and research to take place. Again, signage at the entrance, reminding students and staff of the expected conduct within the library. Inside the library, on the stairwells, at the reception point, reminders of proper mask wearing. Stickers on the floor reminding people to maintain social distance of 1.5 meters. Notices on the walls reminding staff and students and any visitors entering the premises not to unnecessarily touch walls, handrails, side walls. Only touch what you must touch. Leave the rest untouched. At the luggage area, we'll station a security officer to be able to check temperature of all those entering the library to confirm that their temperature is within the required parameters. Also, at the point of entry, there's an alcohol-based automatic sanitizer dispenser so that all those entering may be able to sanitize their hands. Inside the library, at the desk, it has also been clearly marked so that the social distancing is maintained. And the furniture, the seating furniture inside the library has been appropriately spaced to ensure that the 1.5 meters from one user to the other is maintained within the library. So as you sit to do your studies, the distance from one person to another will be maintained at 1.5 meters. Again, you can see the furniture, the floor, well made for appropriate cleaning. Information communicated to the students inside the library: no entry for anyone with temperature above 37.5 degrees Celsius. It is expected that all wear their masks appropriately, that they exercise cough etiquette, and they make sure that all times their hands are cleaned. As you leave the library, outside the kitchen, there are also hand wash stations with posters communicating more information and instructions on how to maintain a safe environment. Waste collection, waste management is properly done. Pathways are wide enough, clearly demarcated, convenient for use, so that you can easily control the flow of human traffic, ensuring that they maintain the physical distances. Throughout the compound, visibly mounted notices can be seen. Hand wash stations have been strategically located and distributed all around the compound. To the place where the core business of technical training takes place, the classrooms and the workshops. This is our tuition complex that has several rooms on 3.5 floors. There's a basement and then 3 floors, floor 1, 2, and 3. In face-to-face learning, the classroom is an important point of convergence. It is important, therefore, that physical distancing is maintained. Classrooms are expected to be marked to ensure that the seats are placed so that the distance from head to head of each trainee is 1.5 meters. In the X direction, in the Y direction, that distance should be maintained at 1.5 meters. There should also be room at the front for the teacher to be able to move and operate a distance of 2 meters between the board and where the students are. Also, signage is important. Constant reminders are important on the protocols that are expected. In every classroom, instructions are given to students. Wear your face mask while in public. Do not lower your mask even when talking. Keep social distance at all times. No movement of seats from the marked positions. Keep all windows open for proper ventilation. Students with pre-existing medical conditions to register at the dispensary immediately. Psychosocial support is available at the guidance and counseling offices. Only come to college on timetable days and stay at home if feeling unwell and seek medical attention. Get help if experiencing symptoms of COVID-19 from the dispensary. Remember, if you have COVID-19, it is not because you have done something wrong, it is just that you are sick. Seek medical attention. In technical training, practical instruction is very important, using all types of machines that can be found in the workplace. This is a mechanical engineering workshop. You can see gangways have been clearly marked to show the places where students are expected to walk. Access to the machines is also clearly marked so that at no time should there be crowding at a machine or along the walkways. Signage for safety is also clearly displayed, both on the walls and within the workshops. Technical institutes are encouraged to use their innovation and technology to fabricate the various items that are needed in the COVID response preparation. They include hand wash stations, water access points, and several others that can be fabricated within the institute. Inside the hostels, it is important that the physical distancing space be maintained. In smaller rooms, where 1.5 cannot be attained from bed to bed, then it is recommended that you use the upper decker on one side and the lower bed on the other side to achieve the 1.5 meters required. In rooms where the width is wider than 1.5, so that you can comfortably get the 1.5 meter between the beds, then it is recommended that both beds be on the lower decker. And the beds that are not to be used should have the bed structure removed so that students are not tempted to utilize it. So those beds that are not being used, remove the bed structure so that they are not used. But the distance of 1.5 meters should be maintained. At all points, where students are likely to congregate, including wash points where they wash their clothes, where they carry out their activities. Social distance of 1.5 meters should be maintained, as is demonstrated in this wash station. Again, as earlier mentioned, water stations distributed. The key thing about positioning of water stations is to ensure that the water is released from a minimum contact dispensing system, that is a tap that could either be a push tap or pedal manipulated tap. At the dispensary entrance, you can see the poster indicating information that is important for COVID prevention and safety. And once again, a view of the general layout of the institute, showing the general atmosphere and ambience within the institute. The dining hall, an important point for every student to pass through to be able to replenish the nutrients in their body. It is important that hygiene is maintained, so hand washing is a requirement before you enter the dining hall. At every entrance, you are reminded to wear your mask properly, to maintain physical distance of 1.5 meters, to exercise cough etiquette, to avoid unnecessarily touching surfaces that you do not need to touch, to sit at designated points and avoid moving furniture from their designated points, and inside the dining hall, while taking your meal, observe table etiquette, avoid talking to each other, no sharing of utensils, and strictly no entry into the kitchen. We would like to acknowledge and thank the following: the board, principal, and staff of Rift Valley Technical Training Institute, our regulators, the DG and staff of Tiveta Authority, the county government of Uasin Gishu, and all other stakeholders who in one way or another have assisted us reach this place. For example, Moi Teaching and Referral Hospital, the County COVID Response Team, and the Ministry of Education, Kenya.
Thank you so much. Thank you so much for the video. I want to, somebody, Michael Otieno Oyoko, he has said, wow, a wonderful video. Thanks and kudos. So thank you, Stephen. So we can applaud the narrator, Mr. Richard Lukuyu, for that very, very good narration. Thank you, Beryl. Thank you. Thank you.
Sorry for the
Andrew Thuo says the presentation is very good and internet hogging is continuity and flow of the video. Do you have it in the links that you provided? Yes, I said you'll get it on the link. Andrew, you'll get it on the link. If you follow the link, that is, if you go to RVTTI, www.rvti.ac.ke, and then click on the COVID-19 preparedness, it will be able to lead you to two links. One, the link to the presentation, to the two PowerPoint presentations, and then a link to the video. So Andrew, if you follow the link, that guidance, you're going to, you'll be able to get the presentations and the video. I think that is it. Yes. Thank you so much. Thank you so much for that. And I want us to, like I said again, let's give an applause, a hand of applause to the narrator for very, very good narration. Thank you, Naomi. Thank you, members. Thank you, everyone, for that. Alex, thank you so much. And everyone, and yes, thank you so much. I would want to, at this juncture, to invite Mr. Chege, maybe also to just to wrap it up by maybe explaining something that you saw in the video and also in the what he had made in the presentation. Maybe there's something that he needs to explain so that you can you can actually conceptualize what he was explaining and what the video has shown us. Maybe just to wrap it up, Panachek.
Thank you, Mr. Tom. I think, am I clear? There's some background noise that I don't know where it's coming from. Thank you, members. In the morning, I promised that we do not intend to disappoint you. And I said the only disappointment can come if you benchmark the result, not the process. I think we have taken you the journey of what we have done. And I was looking at the charts. I may not be able to react because we are the ones who did this work. But what I can only encourage you, there must be something that you have picked to take back to your institution. Just look at your institution. Look at RVTTI. RVTTI is a very big compound, such that even the work involved was so much. There are those who may only need 2 days to do most of those things and be able to achieve all what you need. You don't need so many posters because maybe your buildings are few. You don't need so many water points because your students are few. And maybe you even don't have space for those water points, but you make sure that you comply. The other one is somebody has asked about where you can get the checklist. I think ECRA is still with us, and possibly your principal has one because these guidelines were released sometimes in June, and they were accompanied with a checklist. So she should be able to share with you, and work on it. And it looks like you still have not started working if you still have not gotten the checklist, but you can still get it and be able to do it. Otherwise, thank you. The video was a demonstration of, was a visual demonstration of what I had said earlier, and I think they have really tallied and it has been concretized. Thank you so much. Back to you, Mr. Tom.
Thank you, Banachege. Thank you, Banachege. Yeah, just like you rightly put it, the checklist, I think the checklist was sent to all the principals. I know here we have trainers, but the checklist was sent to all the principals of all TVET institutions, both public and private. They should not be worried about the checklist. If not, you can also go to the website of TVETA and you'll be able to get the checklist. I think I I said that earlier. The checklist is also on the website of TVETA Authority website. You can get the checklist for COVID-19 preparedness. I want to, at this juncture, like I said earlier, I'm glad we're joined by two members from the TVET Authority. I would want to give Madam Bibiana an opportunity to say jambo and also mention one or two things that she plans to do in this financial year, especially with the members of KENAPCO. So Madam Bibiana, you can hear me, you can unmute yourself and then please make your remarks.
Yeah, hello, thank you, Mr. Cho. Good afternoon, members of KENAPCO, the private institutions. Thank you so much for attending the sensitization training in readiness for reopening of your institutions. We are glad that we are together in this. We intend to ensure that all our technical institutions adhere to the COVID protocols and alongside our TVETA audit requirements. So as institutions, you know clearly that we have the internal quality assurance officers who've been carrying out their quality audits, and the Department of Compliance has been going around auditing your institutions. So part of what you've seen or you've been taken through is what we emphasize. As a Department of Outreach, we intend to carry out trainings for internal quality assurance officers in the course of the financial year, and we will be inviting you to come for these trainings. So we therefore expect your principals or managers to also appoint members of the internal quality assurance unit, at least 2, so that when we invite you for the meetings, please attend because it's important. Because this is one aspect that we'll be looking for when the compliance and enforcement team come to visit your institutions. Otherwise, I hope we have all your contacts for today so that when we have meetings and any other activity that we expect you to attend, you'll be able to do so. Otherwise, thank you very much, and I hope you have enjoyed the training. Thank you, Mr. Tro.
Thank you so much, Madam Bibiana. We also, with the team, I think we have from accreditation department, we have Julia Serem, If you hear me, Serem, you can just unmute yourself and say Jambo. Wherever you are, I've seen you. I've seen, yes. Serem was also part of the team that was preparing this. I wanted him to say Jambo.
Oh yeah, the system is requiring me to be unmuted, but I've been successful.
Yes, yes.
Thank you so much. I thought you should have let me speak before Madam Bibiana. Yeah, you know, once your seniors speak, it's not good, but somebody junior speaks. But anyway, thank you for that, giving me this opportunity. Thank you, Madam Bibiana, for also being with us. I want to thank all of you, the whole team, Mr. James Chege, Andrew To, and the rest of the team from RVTTI for doing quite a marvelous job. I must say it's great to be together in this journey in ensuring quality and relevance in our TVET institutions, as well as improving access and equity in our TVET system. During the ongoing, I picked maybe 2 questions that I think is relevant to my department, which is accreditation department.
Serem?
Yes.
Yeah, sorry for that. I think I'll give you an opportunity to respond to the questions when we get there.
Okay.
And sorry for that protocol, because I think I think Madam Bibiana was in before you got in. So sorry for that. Yes, sorry for that.
Thank you.
Okay, so maybe when it gets to I've seen about 2 or 3 questions that I directed to you. I'll be able to share the questions, and you'll be able to respond. So when we get there.
Thank you so much.
Okay, thank you, and asante sana. So thank you, members. Thank you for that, and I think we've been able to see at least the presentation. We'll be able to get through the presentation from the medical doctor, and also the presentation from Mr. Chege from RVTTI, and also the video. And I think now we've been able to see what they have done in terms of compliance and how they have interpreted their checklist. So like they have said, it's about the results. You know, it's not much about the results, but the process. So that, like I said, we have different setups, and we can be able to work towards achieving this compliance. When the directors talked in the morning, he said, we do not have, from his speech, you could see that we do not have the luxury of time. We need to get prepared as soon as possible because I think also God is gracious enough. We're seeing that the numbers going down, and if the numbers, if the curve is flattened, that announcement for reopening might come sooner than later anticipated. That's what I'm foreseeing. So we need to get ready, and therefore, as private institutions, like the PS also said during the opening remarks, we're all this serving the Kenyan child, and therefore we need to move as a TVET fraternity, as a family together, and therefore we need to benchmark. I know there are many institutions that have done better, and we could also be able to share. Please share. I think the other day when we had the public institutions, we had somebody from KTTC sharing what they've done, so that all of us could be able to learn. I want us to go to the charts, and there are questions that I've seen that are directed to the doctor, to Dr. Naomi. Maybe I'll read a few questions, and then we will move on we'll move in that order. Maybe allow me to scroll through the charts. Okay, Julia Serem, so I want you to pick this question. There's somebody who was asking about the requirements for registration of trainers of TVET. So that's one question, you can pick that. the requirements for registration of, trainers at TVET.
Okay.
And then there's another one. How long does it take for a trainer to get registration number? Maybe that. Just pick them, and then I'll give you the opportunity to respond.
Okay.
Just let me pick quite a number, then I'll give you the opportunity to respond to. To the doctor, Dr. Naomi, there's a question. Thanks, Doc, for the great presentation. If I may ask, please, COVID-19 has nothing to do with blood, as in the virus the virus cannot enter blood systems like HIV, and therefore blood transfusion from a COVID-19 patient is safe. Maybe you'll make a comment about that. Again to the doctor, in the event that the response team takes long to attend to the isolated individual, how do we attend? At least to feed him or her, given that we do not have PPEs. I think he's asking, in the case of an institution where there are no PPEs, and maybe a case has been identified and the response takes takes time to attend. Maybe again, the doctor will comment on that. Maybe I can pick a last one. Okay, this is from Shitiabai Michael. He's saying, how do we handle someone in a critical condition at school in absence of PPEs to handle a person? Okay. Maybe you can respond to those ones. Serem, allow Daktari to respond, and then you can also respond to the two questions.
Okay.
Yes.
Thank you so much, participants. I want to respond to the question that have been directed to me. I just want to say that at least you must be having a one trained person who will handle that that suspected case. It can be a nurse, can be at least a medical practitioner, train that person so that at least they can help you under that problem. Concerning the PPEs, this is the new normal. So at least I am requesting you to have some PPEs, because now who will handle that person? Especially if it is you the one with fear. You come in and you have those problems. Nobody wants to handle you because maybe you don't have nobody has the PPEs. So we need at least one person who will be there at the triage area, who is well trained, so that maybe in case of any critical condition, is able to handle. And even in the isolation unit, there is a protocol there, what you need to have inside there, maybe a bed, a chair, maybe some screening machines that it is required for at least to make that person comfortable. We need to feed the person. We need to make that person as comfortable as, even if he's presenting with the signs and symptoms. So we need still to attend to that patient, meaning we need to have the PPEs on, at least for one person. If you are in an institution where you can liaise with a nearby facility, let them help you on how to go about the isolation unit, what are the requirements that you need, so that at least you are well informed. There was another one on COVID-19 patient is safe. Okay, blood transfusion from COVID-19 patient is safe. Yes, it is safe, but we are still doing the research. We are not able to transfuse that infected, because the blood undergoes a lot of screening. You are not just bringing blood from anywhere. We're supposed to undergo a lot of screening before we transfuse on our person. So it is not that when you as maybe a COVID positive person donate the blood, we just go with that blood and transfuse another person. It undergoes a lot of screening. If it is not okay for those for the technical people to give, because all the blood are being taken the transfusion, the blood transfusion unit. So those all blood are being screened, and then they let us have it. They supply to the hospital. So there is a lot of screening before we get that blood. So although SARS-CoV-2 RNS has been detected in serum or plasma from infected patients, there are no data or cases suggesting the risk of transmission of SARS-CoV-2 blood transfusion. But we are still on research. We are still researching on this. We have no a lot of data that tell us. So we cannot risk. We are still studying this disease, and we are still up and down trying to know much about it. So I think with the isolation unit, with the PPEs, with the trained person, for me, I feel it is good for you to have at least one person to help you out, because sometimes this someone can present with some cough, and then all of a sudden it might change, might be having even a difficulty in breathing or something. So they must have a person to help. Even in the isolation unit, I will provide you can have a portable oxygen port that is still okay. But I hope and I pray that we cannot reach to that level, at least, but we must get prepared on this. Thank you so much. I think I've answered you. You still have a question, I will still try to answer. Thank you so much.
Okay, thank you. Thank you, Daktari. Thank you for those answers. And I think the checklist also guides, and like Mr. Chege said, some institutions would have, it's not a must that you must have a medical, you have departments that have trainings on medical areas, and those can be trained and they can be used at least. And I think the checklist give guidance just to add on what you've said, Dr. Mr. Serem, there are two questions. Maybe if you can give a response.
Yes,
then,
yes.
We'll move on. Yes.
I will try as much to respond to these questions. The first one was, what is required for someone to be registered as a TVET trainer with the TVET authority? Okay, the first requirement is, of course, you must be a citizen of good standing with the law. So therefore, we require you to have a certificate of good conduct. Secondly, you must have attained the minimum qualifications. That is a craft certificate in a given area of specialization. So that being the minimum qualification, you must have a craft certificate just to be able to teach. Thirdly, you need to have evidence that you have done some pedagogical training. And that includes either a postgraduate diploma in education from a university, or you should have done a diploma in technical education from Kenya Technical Training College, ATTC, or have completed an instructor training course from also the same institution, KTTC. The second question, I believe, was please bring me to speed on that one.
Okay, I think it was how long does it take to get registered as a trainer?
Oh yeah, you're right. So yes. For you to be able to be registered as a TVET trainer, the process actually is to be accredited and registered. By law, it's supposed to be 3 months. The process should take 3 months. from the time of the application all through to presentation and approval by the TVETA board. But we must say as TVET authority that we may have not sometimes been faced by challenges, especially during transition from the manual system to the MIS. And I believe it may have taken longer than that, but once the MIS is completely up and running, we expect that this process should not exceed 3 months from the time of application to the time you are listed as a TVET trainee. Thank you.
Thank you, Sharam. Yes, I think you put it right. That is it. So members, I think you put it in right. Maybe let me pick on other questions. One, there's a question from Sharon. She's saying the speed-first biometric reader is so efficient and time-saving. Works better than the thermogun. She's asking about the cost. And then somebody's asking, in case of class shifting, I think maybe Mr. Chege will comment on that, and this one also too. In case of class shifting, in the case of class shifting them, disinfecting the classroom, after how long of class disinfection should be the next class be conducted? I think that's what that is Jeremiah Oundo. Okay, the question is not clear, but he's saying after disinfection, how long would the next class be conducted? I think that is a question from Jeremiah Odundo. There's a question from Timothy. What chemical to be specific? What chemicals to be specific are used for disinfecting classrooms and other surfaces that need to be disinfected? I think that's another question. That's a question also on the same from Timothy Kiplagat. Again, John Mayo, the cost of speed-first biometric device. And then John Mayo also asked a question: is the tape used to mark the floors permanent? That is, I think there was a sticker that was that were used in the tile rooms. She's asking whether it's permanent. Eric Onyango again on the cost of the biometric reader. Michael Otieno still again on the same, the cost of that biometric reader and more. I think you've asked how much does it cost and how do you access it? How do you access it? I think that is from Michael Otieno. Let's move on. Okay. Looking for okay. Okay, Onesimus Masila. What happens to institutions that will not have registered TVETA trainers? Onesimus Masila. Maybe we'll respond to those. Okay, there are questions. There are a number of questions on one, biometric, the cost, how to acquire. Questions on chemical used. Questions on time lapse between disinfecting one class and the other. And then Onesimus is, I think this will go to, maybe Serem would also make a comment on that related to what he had answered about what happens to institutions that will not have registered TVETA trainers. Maybe I'll leave it, I'll give that to Mr. Chege, maybe to comment. And then, yes, I think Mr. Chege and I don't know that you'll also be able to comment on the chemical and the disinfection. Yes. Karibu sana Bwana Chege.
Thank you. On the cost of the face detector. I don't want to give a cost, a figure. And the reason I don't want to give a figure is that these gadgets are available in the market. And they vary from one manufacturer to another. And they also vary in what they can do, the capacity. Like ours, I have said, we have, it has 3 functions. It can be able to detect the face, it can be able to take the temperature, it can also be able to detect the mask, whether you have. There are those ones that can only take the temperature. There are those ones that can only take maybe the face or the temperature only, because for this case, it is meant to take the temperature. There are those ones that have even more. It can be able to detect other features. So, and what you can do, you can be guided. If you Google, you can be able to get all those features and maybe see what you need for your market. In any case, these things are becoming cheaper. You remember we were buying masks at 700 shillings. Today you can get a mask at 20 shillings. Sorry for that. And so I would just advise you, if you're in Nairobi, if you're in wherever you are, if it is in Eldoret, you can still find out from the suppliers and get one that is suitable for you. Number 2, actually the biometric cost has a question that has been coming up, and I would not want to give a figure because I'll tell you it is 2,000. You go and find it is 10,000. You will insist I was told it's 2,000. I tell you it is 10,000, then you go and find it is 2,000. Then you imagine that I did not tell you the truth. Just to find out, and you are likely to get a good price for one. The stickers on the tiles. The stickers are not permanent as such that they cannot be removed, but they are durable. Once you clean the tiles and place the sticker, then it can be there for some time. Just like the ones you see in the supermarkets where we are told, step here. They can be there for some time and they can also be removed. I saw a question of somebody asked, how did you conceptualize all this? I said the first step we did when we received the guidelines and the checklist. What we did was we gave ourselves time to read, each one to read and interpret it in their own way. And we shared, how did you look at it? Then we sat down. We had a committee of about 7 people, top management, chaired by the principal and my colleague, deputy principal, and the registrar, and some other members, and the dean. So when we looked at that, we moved from one step to another. We also had the quality manager from one step to another. So from there, we looked at, we divided, like I showed you. There was the infrastructure part. Who was to deal with infrastructure? What did we need? Go around, look at, map the institute, see the toilets that are there, see the water points that are there, and see where we need to add. So once you have done that, there are those people who dealt with the posters. Source for the posters, because the posters, you don't just design your posters, because most of these medical messages are usually, you get them from World Health Organization or the Ministry of Health, just like the HIV messages. You can't just sit down and have your message, because you may stigmatize people and you may scare the people. So we had that team. We had another team that dealt with the timetable. I've told you about the timetable. 2-3 people. Whoever deals with the timetable in the institution did that, and also the marking of that one, of the classes, and seeing who can fit in which class. We also had now the team that was to do the training, contact the county response, contact the MTRH. So I wouldn't say it was one person who did it, but we were working as a team and we were meeting very often. I can tell you we did 9 meetings before we finally got our way and so this one will work. And you can be sure those meetings we had things that were not working, we change, we do all that. I think the other one is the chemical used. I'm not very good in chemicals. I don't know the composition, but what I know, the chemical is called hydrogen peroxide, and it is stabilized with the silver. That is the chemical that we use. It is not, has no effect, much effect. And when we use that, fumigation machine, it actually hits. Actually, what it releases is not like the spray cans we use in the chambers, that after you have sprayed, you see water. This one does not release any water. You don't see any dryness because we even fumigate our offices. And after fumigation, you can still use the office. Somebody asked, what is the time lapse? Now, when you're making the timetable, if you look at the guidelines say it is good to have a class, one group of students being stationed in a room permanently. And that may not be very possible because there are courses that have very few lessons, and there are those ones with very many lessons. So what we have made our timetable is that a group of students will be in a specific room for a whole day. At the end of the day, we are able to fumigate before the next class comes the following day. Because there are those groups that you can squeeze their lessons for 3 days or 2 days. Then that class is used by another group that is there for lessons maybe for 1 day or 2 days. We have some courses, you know them, that do not have to have lessons from Monday to Friday. I think I've answered the questions. Is there any other one, Mr. Tom?
No, we'll go. I'll go through. Thank you. Andrew Thuo says a quick one. Do you have a tentative checklist for the great job RVGI has done? I think RVGI used the same checklist that has also been sent to all the other institutions. So I don't think, but Andrew Thuo, there's another checklist. What Mr. Chege said is that they met and they were able to plan, to conceptualize and plan and form committees each to handle items in the checklist. I think we are following the same checklist. I recommend the basic education sector to visit and emulate RVTI. That is Prasha Wangari Muru. That is okay. I think they've also been given their own guidelines. Yes, somebody's asking a question that maybe this is from Geoffrey Kiprono. The thought of trainers from KTTC as PSC registration in the concluded recruitment, that I think that is beyond this, but this can be picked by the leadership of KENAPCO. They can pick that with the authorities. Like we said, not okay. We're dealing with COVID preparedness, but some other questions could be beyond here. But I think Madam SG is with us and can be able to pick that. Okay. Let's move. Okay, I think Mr. Serem had given on how trainers can register. So the procedure and the requirements and the deadlines. Already, of course, I think together I issued a circular and the guidance on how to do that. And I think Mr. Serem had explained that. Kimblagat Kemboy is asking again to Serem, is there an alternative that can replace teacher education pedagogy, such as master's qualification or any other? And I had seen another qualification. Okay, there's somebody, Patrick Wambua Muya. Your institution is ready, prepared as per the checklist. What is the next step? I think the next step is to, if you go to the TVET website, there are guidelines. After meeting all, if you think that your institution has met the requirements of the checklist, there's a form on the website that you need to fill and apply so that you can be scheduled for assessment. So that is a procedure. Once the institution feels that they are ready and they feel they're ready for this, there's a form in the TVET website where you fill and apply, and the authority will be able to schedule for an assessment of your institution. Again, there's a question. Most of the TVET, most of trainers have been teaching for more than 2 years without TVET numbers. They've never received any feedback. I think Mr. Serem had explained that, but maybe you can still add. Somebody saying, Mr. Serem, please consider relaxing requirements for registration of trainers beyond instructor training. Consider those who have undergone TOT training and have accumulated training experience. After all, recognition of prior learning is part of CBETA. I think there are guidelines to that. My question goes to TVET again. Can a degree holder who has not undergone KTTC but with teaching experience get a TVET number? I think Mr. Serem answered that if you are a degree holder in a specific area, you can also do postgraduate diploma in education, and those who have diplomas can go to KTTC, or they can also get the instructor training if they have craft certificate. That is to Alex Kanga. Again, there's a question on employment of KTTC trainers, and I said that could be beyond here, but maybe it can be picked by management. Okay, there's a question here, Mr. Serem, of the people who applied earlier manually, and now that you've shifted to online application, what happens? And then
maybe I can say something about that one.
Yes. And any other? Maybe I've commented on others.
Oh, okay.
Yes, I've commented. No, I'm saying for those who have commented, Mr. Serem.
Yes.
You can expound more so that it can be clear.
Okay. Remember, there's a time TVET authority had asked for applications to be done using hard paper, and due to the bulkiness of the paperwork involved, the organization required that trainers make an electronic application by a TVET accreditation email. And so those who are able to do that through the TVET accreditation email, most of them, I'm sure, if they were qualified, they should have found their way to our TVET website with the TVET number. However, now the process has already transitioned again from that email. We now want our trainers to apply via the MIS platform. So if in case you have been left out, you can still do it. What you need to keep is the transaction reference numbers for those transactions that you did, and you can use them now on the MIS. That is if in case you have not seen your name in the TVET website. You had asked about earlier, what happens to institutions that will not have registered TVET trainers? Okay, by law, the law requires that for an institution to be accredited and registered, then it must have attained some requirements as specified by when you look at our assessment tool. There are those requirements that we recommend the institutions to have. For example, you should have, going by the curriculum and implementation, you must have qualified trainers in order to be allowed or rather to be licensed to train. Sometimes you may have an institution which has met, let's say, all the requirements, which include physical resources, physical facilities, the management and leadership, the sanitation facilities, it has workshops, and also adequate classrooms, just to mention but a few. However, you may find that management, the institution do not have qualified trainers. So in that situation, TVET authority will go ahead and and register the institution only, because we have that option. We can register an institution which we can see that it has met all the requirements. But that means that you shall not get a license to train any courses because you do not have trained trainers or other qualified trainers. So there's that option for the institution to be registered only and not have a license to train. So that could happen if your institution does not have registered trainers. I hope I've met your questions. Over back to you, Mr. Andrew.
Thank you, Salem. I think you've answered it there. There are many other. I think we have an email in our website. If people are getting challenges, you can also go to, let me just type, if you're seeing, support@tveta.go.ke. If you have any question, regarding registration, you can always, if you have any challenges, you can write a mail to that, and you'll be addressed. Let me go back a bit. Yes, I was going to the comments. Andrew again is making a great comment to Madam Ekra, and he's saying it's a great job bringing together private institutions to the face of championing quality education for our youth. How can we further develop capacities, and is there an association to help champion private institutions' concerns? And I think that is why KENAPCO is there. Maybe Madam Ekra is taking those comments, and I think like from the opening on Tuesday, when it was the remarks were made by the PS said they had an engagement on Monday with the leadership of KENAPCO, which is an association championing the issues of private TVET institutions. A very interesting one. Abdul Rashid Mutemba is saying, shall we be provided with some lunch now that we're approaching lunch time? I think that's a signal that we are beyond time. We are actually 9 minutes out of the scheduled time. So maybe Madam Ekra will comment on that. I have no comment. Okay, there's one question to the doctor. If smoking is a risk factor with severe outcomes among COVID patients, smoking as a risk factor, I think that I can pick that, Daktari. Okay, Andrew Tu again, an applaud for the great partnership. And he's saying we applaud the DG and the CS. We look forward to be on board with the Minister of Education and TVET endeavors. There's another question again. I think this has been a common question. Doctor, can lemon and ginger prevent COVID? What about being registered as a verifier and assessor? Maybe Sereb, you can pick that again. What about being registered as a verifier and assessor? Is it a must for one to attend KTTC if one has a bachelor's degree? If you have a bachelor's degree, you can go for a postgraduate diploma in education offered in a number of universities, and you can get the pedagogy training. I think that is the answer. Minimum requirements, Mr. Serema said, class certificate with at least instructor training. If you have a diploma and a diploma in KTTC, and that should be. Medics say we should use a face mask for 8 hours and dispose. That is the best mask. What is the best mask for use by students for a whole day? I think again that goes to the medical doctor. Do medical college lecturers have to register as TVET trainers and attend KTTC for that? Yes, if you are trained in, for example, in pharmacy, medical lab technology, and you want to train to be a trainer in a TVET institution that trains on medical, it is a requirement for you to be registered, to be licensed by TVETA. You must also, you have to have a pedagogy course. Again, to the medical doctor, who's supposed to be in this isolation tent in an institute, must he or she be a medic? Great team. Okay. How does one register with the TVET MIS? Just go to the TVET, the website of TVETA, and you'll be able to register. The question of chemicals, I think that has been answered. Okay, I think that's the end. Those are the ends. Anyway, let me begin with the doctor and any other. I think Mr. Chege, if there's any other something else, Mr. Chege and Mr. Serem, you can be able to respond, and maybe we'll also give Ekra to my comments. I think those are the. Thank you, and thank you very much for those very good comments. Daktari, I think you've had the comments that have been made.
Thank you so much, Mr. Cho. I'm just commenting on some of the things that the participant has raised. For example, smoking is a risk factor. It has been a risk factor for some of the medical conditions like hypertension. This is not exceptional. It is still a risk factor. If you are smoking, please just do away with it, because during smoking, the affected areas are the respiratory tract areas, respiratory system. So it is actually a risk factor for you. So I think for that you should just stop that, or try to minimize smoking. So another one, can lemon and ginger prevent COVID? I say no, but it helps your system, immune system. You just have to build your immune system, maybe help your body functions well. It is not a prevention mode. It has never been it, but at least it prevents some flu symptoms and the rest of the things. But for free, it is not a prevention for the COVID-19. Another one, medics say we should use a face mask for 8 hours and dispose it. It depends with the environment that you are. For us at the hospital, it is strictly about 8 hours because of the nature of our work and the people that we are surrounded by. For you, if you're not coming into contact with so many people, you can use your mask until the end of the day. You discard it when you reach home. For the students, it depends now with the maneno issues na cost. If you tell a student to be buying a surgical mask, that's another thing. So let them have their mask that they have, only that they should be clean. At least one mask should be used each day. Let them have, even if they have a cloth mask, let them know which type of cloth mask they have. They should be 3 layers. When you touch your mask like this, there must be a upper layer, second layer inside, and the third layer, when you pull it like this, there is another layer. So about 3 layers of the cloth mask. That is still safe. If you can afford surgical mask, it is coming down. Thank God for that. It is actually, it's about nowadays 600, 500. It is coming down upper of 50. So maybe when you guys will open, the surgical mask might have dropped. So I think those were the questions that I was asked. I don't know if I left one. Oh, in isolation area, should it be who should stay in an isolation area? For me, I could prefer if you will have a medic, because some even present with so many other severity of the disease. For example, difficulty in breathing, you have to connect the mask on and maybe put her or him on oxygen. So at least a person who understands and a person who knows how to do it. I think it should be a medical person who is also trained to respond on the issues of the critical care. So, or even a first aid, what you are supposed to do at what time. And even those who can do the, what we call, there is some people who can come actually with difficulty in breathing, and you need to do to really help them, to back them to all those first aid that a person who understands can do it. So I will provide, you have a medical doctor, not if you have someone medical person who can understand that, that will be so good for you. So thank you so much. Back to you.
Thank you, Dr. Thank you, Dr. I think you've answered the questions. Okay, I think when I went through the other questions, registration with TVET MIS, I think I'd explained to register as an assessor, or a trainer, an assessor and verifier. Again, I think Mr. Serem explained now that there was a shift from the manual to the MIS system, and they're actually working on registering people as trainers. Assessors and verifiers would also come, and you understand that to be an assessor, to be assessors and verifiers, you also have to undergo training from other, to be trained by SEDAC and other, examining bodies, so that you also be able to qualify as an assessor and a verifier. And therefore, that is coming. But for now, what the authority is concentrating is registering those applicants, those applications that have been made on the system as TVET trainers. And I've again given the email for any challenge. Please write to that address, support@tveta.go.ke, and you'll be attended to. Now that's I'm looking for his name. There's somebody who has commented about lunch. We actually beyond the time by 18 minutes, and I want to actually, that is Abdul Rashid Mutembe. He had said that he had talked about lunch. So I think we are beyond the time, and I want to. I know there are many issues, and I've seen on the chats, Madam Ekra has provided some information about KENAPCO. That is, they've also given the website at www.kenapco.org. KENAPCO administrators contacts, and then the phone numbers, and also an email. We have kenapco@gmail.com, info@kenapco.org. I think all that. So if you need, and we've given even us for TVETA and any other. If you need any more clarification, please you feel free to contact the relevant authorities. Otherwise, I want to bring this to a close, and I want to thank you so much for attending this training. I hope it has been very beneficial. Now you are the ambassadors, not ambassadors actually. You are the director said you are like the heads of this is a department of COVID-19 preparedness. So you're like the HODs, and you'll be able to help your administrators and principals to ensure that your institutions are compliant. You can do it. We've seen it can be done with the available resources. The issue is to be able to ensure that when the signal is given for reopening, your institutions do not again become the epicenters for spread of COVID-19. You make sure that you are safe yourself as trainers. Everybody, all the staff are safe. All the trainers will be safe. So we expect this, that after this training, you'll be able to cascade this to everybody in the institution, so that at least you bring them to the same page. So otherwise, I want to thank you so much. I want to thank KENAPCO, the Ministry of Education, the TVET Authority, Rift Valley Technical Training Institute, and all the stakeholders for making this possible. We hope, having gone through this training for the last 3 days, and also for another 1 week for the public sector, we shall have been able to cover big ground for the TVET fraternity, so that the TVET sector can be ready to reopen if that signal is given. Others, I want to thank you so much and appreciate your participation. I think it's been very, very engaging, and I want to take it back to Mr. Chege to maybe make his closing remarks, and then Anita would be able to get us through the closing session. Back to you, Mr. Chege.
Thank you, Mr. Andrew To. Thank you, members. I can only thank you. Thank you so much. Thank you so much, ECRA. You have been with us for 3 days. That means you care for your members and you would like to take your members to the next level. On behalf of my chief principal, I want to convey our gratitude. We as the RVTTI community, we have been able to share what we could because the Bible also encourages us to share what you have. Because when you share, more shall be added to you. That is what we believe in. And that is why whatever we did, and when the minister came and told us you have done well, I think you have seen it even in the papers. Wherever he goes after that, he says RVTTI has done well. Then we asked ourselves, why can't we also share? And the ministry asked us, TVETA asked us. I want to thank TVETA so much. They have collaborated. They helped us, even in shooting the video. They really assisted us. They guided us. Even when we called them upon to help us, I said we looked for assistance whenever the situation demanded. And that is what the way to go, members. Don't die alone. Where you don't understand, ask your next door neighbor. Ask anybody you can get contact. I've seen ECRA has provided the email where you can get, and the website where you can get information. You can be able to get information because the next level is we all need to survive. We have been reading in the papers where so many private schools, primary schools and secondary schools are closing because they find they cannot be able to continue. But I want to encourage you, don't die hard. Usife moyo. There is still hope. When COVID ends, post-COVID, I tell you the economy will grow twice as much. This is usually just in those ones who have done economics, you know about the trough, then the economy picks up. And very soon we shall be able to enjoy the boom. So members, let us go and do what you have seen we have done. We thank you so much for the opportunity to share with you what we have done. God bless you. ECRA, Mungu akubariki sana. TVETA, God give you more strength and more will to assist our institutions. Asanteni. Thank you. Those are my remarks. Back to you, Mr. Tom.
Thank you, Mr. Chege. I want to Anita to wrap it up. So thank you so much. Thank you, everybody. I think we've said much, yes.
Okay, thank you so much, participants, for attending the training. I wouldn't want to water down anything that have been said. So just appreciations, hoping that you've learned a lot. We are very proud that from the charts, we could see a lot of accolades. Thank you. We are proud that you are able to learn something from us today. So I'll straight away go to the vote of thanks session. I'll welcome Mr. Jotham Odhiambo.
Sorry, Anita.
Yes, sir.
I'm seeing ECRA on.
Oh, okay.
I think she's played a big role. Before we go to the vote of thanks, please allow her to say something before we go to the vote of thanks. Yes.
ECRA, welcome.
Yeah, thank you, Mr. To, for lobbying for me. I know we are hungry and we didn't offer the usual conference snacks. So at first, on behalf of KENAPCO, I want to apologize to everyone. We are not this mean. It is that it is the new normal. So we are looking forward to post-COVID-19, and we will have our usual conference snacks and we will make friendships. So thank you so much on behalf of the association and all the members that attended. I would love to pass our gratitude to the PS, to the DG, to the Director Technical Education, to Dr. Tano, James Shege. We are grateful that you have been with us the last 2 days. Mr. Rukuyu, Adruto, Anita, Kiplangat, we have been working very hard with Mr. To behind the background and Mr. Kiplangat to make sure that all the members get the links and everything. So thank you so much, Dr. Naomi. I have really learned a lot. As a trainer, almost to start COVID training. So thank you so much. We have really learned a lot. So we really promise as an association to benchmark the process and not to copy paste, because we are supposed to be innovative. We will crystallize all this and implement it in our own way, in a way that it works. Members who have been asking, we are not, we don't need to implement anything monumental, as the DTE director said. All we need is to pick what can work and what is within our reach that we can help to save lives, because that is basically our role, because God has entrusted us with lives. When you have students in our institutions, we are entrusted with lives just like the pastors. So we are great people, we are important people, and we are helping this nation move to the next level, because this country is dependent on the TVET sector to achieve its Vision 2030. So anytime that you have these students in your institutions, just know that whatever you're doing, you're holding brief for the president, and you're holding brief for God, because he has entrusted you for with the students in your institutions. So we look forward to working together. This is a great milestone for those who joined late. As I said from the opening, it is the first ever conference in conjunction with government and KENAPCO, the Association for Private Colleges. So it's a great milestone, great friendships as we start our partnerships and implementing the public-private partnerships. We look forward to learning from each other. Maybe what the private sector is ahead, like what we are doing in the ODEL training. We are steps ahead in terms of implementation of e-learning, but we are learning together in the regions. Like today, we had those trainings in Rift Valley region. We had 204 participants. We had Western going on, and our members are still present. So this is a kind of partnerships that we are looking forward, and we need to keep implementing. Thank you so much, RVTTI, for setting the benchmark. Your benchmark, I would agree, and I would say, Mr. Chege, please pass it on to Dr. Tano. Your benchmark is high, and we hope that we shall get close as we try to implement what you're doing. We promise we are friends of government. We are friends of government as KENAPCO, and we will continue being friends. And we are grateful to VETA. Mr. To kindly pass our gratitude to DG. We are very grateful because he has really been committed to this process and to make sure that it is a success. So thank you so much, Andrew To. We do not take you for granted, even sitting with us 3 days. It is such a sacrifice. We've not seen this happen before, that government is making sure that private sector is not left behind, because you could have easily moved on with the public TTIs because they have done something, but you took your time to. So that is on behalf of the association. Thank you, thank you. I can talk until tomorrow out of excitement. You can notice that I'm so elated because this was a huge success. And thank you. I take it back to Anita. Thank you for being with us the 3 days. I look forward to coming to Eldoret, and I promise, KENAPCO is not mean, it's only that we could not send you the cup of tea virtually, but I promise you that we shall sit and enjoy a cup of tea somewhere in Eldoret very soon. Thank you.
Okay, thank you so much, Madam Ekran Dungu, for those closing remarks. I haven't worked with you, but I can tell that you're so passionate in what you're doing. So may God bless you so much as you serve the KENAPCO people and even Kenya at large. So members, we know that we've really taken time, but I believe it is worth the time. So allow me to welcome Mr. Jotham Odhiambo to give us a vote of thanks, who is the Director, Kilifi College of Accountancy and Chairman, KENAPCO Coast Region. Welcome, sir. If you can hear me, kindly unmute yourself and give us closing remarks, or rather vote of thanks. Is he with us, Mr. Tom? I had seen him earlier. Okay, yeah, he's with us. Jogam, kindly unmute yourself.
You hear me now?
Yeah, loud and clear. Proceed, please.
Thank you very much, everyone, for the opportunity that we have today. I know people are now tired. It has been a long day, and we appreciate everything that has been going on since Monday. Let me start by saying that I'm privileged to have been asked to give a vote of thanks on behalf of KENAPCO and members who participated in this training. And as you have been told, my name is Jotham Odhiambo, Director, Kilifi College of Accountancy here in Kilifi, and also Chairman KENAPCO Coast Region. On behalf of all the members who participated in this training, on behalf of KENAPCO, and my own behalf, I extend a very hearty vote of thanks to all the speakers for gracing this very, very important training and for sharing with us your experience and expertise on COVID-19 protocols and how we can safely reopen our colleges. Let me take the opportunity to thank the ministry for accepting our request to also include us in this training. Just like our members have said before and our Secretary General said earlier, we are aware that the public institutions did a similar training sometimes back. And when our request came, you accepted, and today we are concluding the whole event. We thank you very much, and God will bless you for recognizing KENAPCO and the role that we do play in the development of the economy of our country. Just like one speaker said, there is no private and public child. All of us are Kenyans, and all of us deserve to enjoy the government services like the rest of us in the public sector. Let me also thank you very much, TVETA, being led by the able Director General, Dr. Langat, and his entire team, those who are with us here. I saw Bibiana, I saw Andrew, all of you for taking your time to train us and to prepare us for the reopening of the colleges. A big thank you goes to Rift Valley Technical Training Institute. We are humbled by what you did to us, by taking and committing your resources to make sure that the private sector also get to understand how these things should be done. And for sure, many were not aware. We just got the checklist, but how to implement it was a challenge. But I want to assure you, having seen that video, having learned from the speakers, we are now able to go. May God bless you. Pass our regards to your chief principal for agreeing to unleash your resources, speakers led by Dr. Naomi Keino and Anita Rotich, for a wonderful work we have done since we began the trainings. We began with the principals. Yesterday we were with the other regions, and today we are concluding. Thank you for taking your time. And as I finish, I also want to thank our KENAPCO leadership, led by our able Secretary General, Madam Ekra. I want to assure you that we are behind you. We will give you support. We are impressed with what you are doing, the mobilization skills that you have, the logistics that you put in place, and how you guide us to get all these services. We cannot pay you, but God will one day reward you. Thank you very much. And to the trainers who came here, we are aware your principals were here before, and you are going to share with them whatever you have learned here. And I want to tell you that before you take care of the trainee, you must take care of yourself. Make sure that whenever you go out there, you are now our ambassadors. Please make sure that you train those who did not come here. There are so many trainers who did not get opportunity to get this one, but now that you are here and you are trained, you can go out there and train others so that we can easily accept to reopen the colleges. I may not be able to thank everyone for your involvement. I know there are so many people who are behind everything here. Thank you for your willingness to ensure that the KENAPCO and the private sector are trained. And thank you for ensuring that this training became successful. May God reward you all. May God remember you. And as we live here, let every one of us remember to stay safe always. And may God bless you all. And God bless Kenya. Thank you very much.
Okay, thank you so much, Mr. Jotham Odhiambo, for that elaborate vote of thanks. We really appreciate. Salimia watu wa Pwani.
Thank you.
Sawa. We are now coming to the end of the session. We started by praying. We want to end by thanking God. So kindly a volunteer to pray for us. Just raise up your hand and we'll be able to give you the rights to unmute yourself and pray for us. Is there anyone raising? Okay, there's Kirui Abraham. There's Kirui Abraham, there's Hillary. Okay, Kirui, kindly unmute yourself and pray for us.
Hello, everyone.
Hello.
Are you getting me? Hello.
Yes, we are getting you. Kindly pray for us.
Let's pray. Let's go down for a word of prayer. I thank you, Lord, for this meeting that we have had. We have learned a lot, that we have a lot that we need to do, Lord. God our Father, you are the Alpha, you are the Omega. You are the provider, and you are the care. You all know us during this pandemic. As you prepare us for reopening for this period, give us our guidance. We also know that we require our psycho-spiritual support for the student and for the staff. Be with us. Thank you, Lord, for every presenter that has presented for us and anything that we have learned. Let us put into practice. As I pray this short, believing and trust in the Lord. Amen.
Amen. Thank you so much.
Amen.
We've come to the end of the session. We can now see all of you. Ekra, karibu to Eldoret.
Thank you. I'll be happy to visit RBI.
Yes. Members, you can now.
It's a pleasure to meet you, Dr.
We
Naomi.
are so much grateful.
Thank you.
Yes,
Welcome to
videos, put on your videos.
Thank you.
Put on your videos now and say bye-bye. Put on your video and say bye-bye. Put your video on and say
Mr. for moderating.
Bye.
Thank you.
Bye-bye.
Bye-bye.
Put on your video and say bye-bye.
Bye.
Bye.
Bye for now.
Bye.
Bye, and God bless you.
Okay, like it.
Goodbye.
Bye.
Bye to all.